This budget hearing conducted by the Committee on Appropriation Adjudication will now reconvene with the Department of Public Health and Social Services, more specifically the Division of Environmental Health. Thank you very much for being here this afternoon, and you were here this morning, so we'll just proceed with your testimony.
Will do. Thank you, Speaker Cruz. Happy Speaker Cruz and I was going to say the members of the Committee on Appropriation and Adjudication, but I'm sure they'll be on their way. My name is Tom Nadeau. I am the Chief Environmental Public Health Officer with the Division of Environmental Health, and with me today are the administrators, supervisors, and the managers of DEH. They are to my left. Turn on the mic, Grace, please. Thank you.
Grace Bradalio, Bureau of Program Support and Information.
Claire Barati, Acting Bureau Administrator for the Bureau of Compliance and Investigation.
Remy Suva, Administrative Officer.
Hi, good afternoon. Mary Lou Scruggs, Bureau Administrator for the Inspection and Enforcement.
Okay, thank you. The overarching mission of the Division of Environmental Health, or DEH as we're commonly known, is to serve and protect the people of Guam from environmental hazards and drug diversion through education and the implementation of governing laws designed to prevent injuries, diseases, disabilities, and death. DEH operates through mandates of 23 statutes of Title 10 GCA, which are enacted for the prevention and control of public nuisances, indoor smoking, littering, along with regulation of health-regulated establishments and consumer commodities. In addition, through the authority of Title 9 GCA, which is under the Crime and Correction Code, Chapter 67, the division has the responsibility of also preventing diversion of pharmaceutical controlled substances. DEH has also promulgated numerous rules and regulations and established policies and procedures for the implementation of the division's programs. A list of all the statutes, rules and regulations, and executive orders and applicable internal policies of the division is provided in Annex 1 of the report. Half-day, Vice Speaker. There are 31 programs in DEH, which can be grouped into 7 major functions, which are food safety, health and sanitation, animal vector control, consumer commodities, radiological health, and education. Preventing harm to the public from environmental health hazard is one of the fundamental principles of environmental health. The division attempts to prevent injuries, diseases, disabilities, and death from biological, chemical, physical, and radiological hazards by implementing its mandates and public education. The metrics of our programs are based on existing laws, regulations, internal policies, and national standards, which are presented in Annex 3 of the, by the way, I presume that you provided the handout. Thank you. In respect to our 2019 budget request, for fiscal year 2019, DEH is requesting $857,946 from the general fund, about $1.3 million from the environmental health fund, and $137,280 from the sanitary inspection revolving fund, for a total sum of $2,298,960 to fund the division's personnel and operation. As shown in Figure 1, just over half of the total budget requested will be from the environmental health fund. This particular fund was established in 2000 for the sole use of DEH, and it derives its funding from revenue generated by the division's issuance of sanitary permits and health certificates. The DPHSS Sanitary Inspection Revolving Fund was also created to assist the division's operation, but meant primarily for conducting inspections of temporary workforce housing. And the monies from this fund come from the annual fee assessed in the registration of temporary foreign workers. Approximately 85% of total budget, which is about $1.9 million requested for FY 2019, will be for personnel, as presented in Figure 2. The remaining $378,448, or about 15%, is distributed amongst the other categories in which contractual services take up bulk of that amount. The distribution of funding of object categories for each of the 3 funding sources can be viewed in Figures 3, 4, and 5. Organizationally, DEH is comprised of the Office of the Chief, 3 bureaus, and the Guam Environmental Public Health Laboratory. However, operationally, the division operates flexibly through shifting of staff and programs, regardless of its organizational structure, in response to changes in priorities, emergency responses, and continuity of operation. The need for such flexibility is necessary as DEH has historically lacked the required number of personnel to implement or to effectively implement all of its mandates. Consequently, every environmental health officer, who comprises over half of the total DH staffing, is assigned 2 or more programs. In fiscal year 2018, 27 positions were funded for the division, as shown in Table 1. 3 of the funded positions, identified with asterisks and highlighted in yellow, are vacant at this time. Thus, there are currently 24 full-time employees in the division. For upcoming 2019, the division is seeking to fund this 25 fill position, which equates to $1,786,455, and the 3 vacant positions for additional $134,057 for 2019, as provided in Table 2. Thus, in total, about $1.9 million is requested for funding of personnel. The activities of DEH can be divided into field and office operations. Each complement the other in the division pursuit of its missions and mandates. Good afternoon, Senator. The field activities of DEH are primarily conducting compliance inspections of health regulated establishments, trapping, identifying, and studying of mosquitoes for surveillance and control, investigation of environmental health complaints, and providing educational outreach and campaigns. The office activities of DEH include issuance of permits, certificates, and registrations, program management, training of health certificate applicants, and administrative financial support. For FY 2019, DEH requesting a total of $343,982 for object categories listed under operations. About 60%, which equals to $204,000, of the total proposed budget in operations will be for contractual services. That includes contracts for leasing of official vehicles, maintenance of the Guam Environmental Public Health Laboratory, and other services necessary for the division's operation. For equipment and supplies, which each comprise about 2% of total requested budget, are for field and office supplies and devices and instruments for use in the lab and in the field. Travel makes up only about 1% of the total budget with $30,000. The Guam Environmental Public Health Laboratory, which houses the food lab and the mosquito lab, was completed in March 2016, but the division was unable to occupy the facility until June 2017. As a result, DEH did not incur any cost in the payment of water, power, and phone services in fiscal year 2016 and parts of 2017. As a result, DEH will not be seeking any funds for utilities in upcoming 2019. Instead, DEH will be using the remaining labs from fiscal year 2016. The amount of $35,466 requested for capital outlay is to procure a lab instrument for Division's food screening laboratory. Because the Division of Environmental Health has been unable to implement all its mandates, it has prioritized its activities through risk assessment. Thus, DEH examined the associated health risk and public impact of each program. DEH directs greater resources into those facilities that cater primarily to the highly susceptible population, such as the young, elderly, and the immunocompromised. When conducting compliance inspections of health regulated establishments, the division applies risk-based inspections, and thus it focuses on areas that have the most impact to the public and ensuring that its regulatory actions are proportionate to the level of risk. The allocation of funds in 2019 for all 31 programs, which are presented in Table 3, reflect the priorities of the division in serving and protecting the community. Also, graphical presentation of program funding by percentage may be seen in Figure 6. The takeaway from Figure 6 is that if you'll notice, the large percentage of the allocation goes to food safety, the health certificate training course, issuance of controlled substances registration, health certificate, and sanitary permit. DEH has consistently assigned its food safety program its highest priority, and it is observed in the proposed 2019 budget. Just over a quarter of the total funding request will be to support the program. Of approximately 3,000 sanitary permits the division issues every year, over 83% are associated with food facilities. It's seen on Figure 7. Because everyone on the island, including tourists or visitors, is affected by food safety that is commercially prepared and served, it is imperative that food safety program be prioritized in action and funding. The mosquito surveillance control program, which will be allotted just under 10% of the total budget, it will be on the total 10% of the budget. Guam is currently free of endemic mosquito-borne diseases such as dengue fever, Zika virus, and malaria. However, these infections are endemic and emerging in Asia and parts of the Pacific. Dengue fever alone infects approximately 390 million people every year. Because Guam has the vector mosquitoes that can transmit these diseases, every effort must be made to prevent the introduction and spread of all mosquito-borne diseases on island. The impact to the public's health and economy will be severe if a mosquito-borne disease was to become established on Guam. Nearly equally funded as the mosquito program is the health certificate training course, which the division recently established in 2017. The program provides food safety training to all applicants seeking health certificates in the food category. DEH is projected to provide food safety training to nearly 28,000 food handlers annually. Eventually, the training course will be expanded to applicants of health certificates in other categories, such as hotels, cosmetics, childcare, which will add approximately 3,500 more. DH programs dedicated to the issuance of sanitary permits, health certificates, and Guam-controlled substance registration will also be allocated a significant portion of the requested budget. This is inclusive of the Plans and Specifications program, which conducts pre-operational inspections of all businesses seeking a sanitary permit. These businesses, along with individuals employed at the establishments who must possess a health certificate, will all be adversely affected if DEH fails to issue or timely issue these documents. Similarly, physicians, dentists, pharmacies, and other needing to dispense pharmaceutical controlled substances will be harmed if their registration is not timely processed and issued. Every year, the division issues approximately, or on the average, of 3,227 sanitary permits, 35,423 health certificates, and 386 controlled substances registration. All other remaining programs will be budgeted accordingly based on priorities and anticipated activities in 2019. It is important to note that regardless of the funding allocation to the 31 programs, the division will always respond and act accordingly to any and all environmental health hazards posed to the public. Provided in Annex 4 are graphs showing the allocation of funds to all environmental health programs by object category. In justifying our budget, provided in Annex 5 is a visual presentation through use of graphs of how well programs of DEH performed in meeting its established metrics in the past 3 years. For programs conducting sanitation inspections that are required to possess a sanitary permit, such as food safety, institutional facilities, hotels, pools, and others, its primary metric is to conduct 4 inspections every year as required by law. Thus, the number of establishments in each program multiplied by 4 would be the metric of that respective program. For example, if you examine the first graph of Annex 5, which is shown on the screen for food safety, which shows the metric graph of that program, the blue bar represents a number of inspections conducted for that particular year, while the red bar indicates the number of inspections that the program was expected to complete as required by law, which would be its metric benchmark, its target goal. With the exception of one, all sanitation programs failed to meet its metric in the last 3 fiscal years, and DEH expects the trend to continue into this fiscal year. Although much resources have been directed to food safety program, it was able to complete only 5% of its metrics in FY 2017. The only sanitation program that fully met its standard was the temporary workforce housing program in 2017. It did not meet its metrics previously since no staff was dedicated to the program at the time. And it's important to note that the temporary workforce housing program was able to achieve its recent metric because it is fully funded through the Sanitary Inspection Revolving Fund, and the number of permitted temporary housing has declined over the years due to fewer temporary migrant workers on island. Other programs that have successfully met its metrics were those tasked to issue health certificates, sanitary permits, and the Guam Controlled Substances registration to applicable individuals and businesses. DEH ensured that all completed applications that were received were timely reviewed and processed. Correspondingly, the health certificate training program provided training to all individuals applying for a health certificate in the food category. Programs addressing public nuisance complaints such as village sanitation, wastewater, solid waste were not all resolved or timely resolved. Also, no actions were pursued in enforcement of indoor smoking and littering. Because DEH has not been able to implement all its mandates, particularly in sanitation programs, much resource and attention have been focused on public education, and this was reflected in its education programs. All such programs were able to meet its metric benchmark, with the exception of the mosquito control and bite prevention education program, which was just recently established. And I'd like to add that measuring public education and prevention can be difficult, and while reported diseases is one metric, many diseases, especially foodborne illnesses, are underreported. An inadequate number of personnel is the primary reason that many programs DEH, particularly those responsible for conducting sanitation inspections of various businesses, have been failing to meet its standard. We simply do not possess the staffing, the number to implement every mandate and thus every program. Consequently, funding the division any less than what is proposed in our 2019 budget will only worsen the situation. To help alleviate some of the numerous challenges of the division, DEH is seeking to recruit in 2019, if so approved, Environmental Public Officer 1, Environmental Technician 2, and the Health Educator 2. The Environmental Public Health Officer 1 will be performing compliance inspections of Island's nearly 3,000 establishments along with the assistance, of course, other inspectors of DEH. Title 10 GCA, Chapter 29 mandates that every permanent establishment be inspected every quarter, which equates to 12,000 inspections that must be conducted yearly. Currently, the ratio of public health officers assigned to conduct health inspection to the number of permanent establishment is 1 to 375, or even 1 to 500, depending on the given priority of the division for that year. At this proportion, every environmental public health officer must conduct at least 1,500 inspections yearly, which is an impossible task. Meeting this quota is further difficult as the inspectors are also tasked to conduct many other duties in the division. The recruitment for an Environmental Technician 2 is also sought so inspections and investigation of public nuisance complaints can be timely and effectively acted upon by the division. An average of 100 public nuisance complaints are investigated yearly, and because nearly every case requires one or more follow-up visits, these complaints require significant resources. In addition, with the revitalization of DEH mosquito program and the construction of the mosquito lab, the technician will be utilized to assist this program by trapping and collecting mosquitoes for their identification, rearing, and testing. At this time, all these tasks are performed by the environmental public health officers, which prevent them from focusing on their primary responsibility, which is to inspect health-regulated establishments and, of course, conduct other environmental health duties. Thus, the recruitment of a technician will not only allow for the timely response of public complaints, but also enhance the mosquito program and relieve our inspectors to focus on sanitation inspections. Just as important as the environmental public health officer and the environmental technician that we seek to recruit in 2019 is the health educator 2. As the field inspectors address the first half of the division's mission, which is to protect the public from environmental hazards, the health educator will be leading the effort in the latter component of our mission, which is public education, such as the execution of the health certificate training course, social media, community outreach to promote mosquito bite prevention and hand hygiene, and the division's annual education campaign that is held in September every year. Through education, DEH attempts to empower the public with knowledge and information about environmental health so that they may make an informed decision to protect themselves and their loved ones. In addition, the recruitment of health educator will enable DEH to generate greater revenue for the Environmental Health Fund. Already, the division has increased its revenue through the enactment of the Health Certificate Food Safety Training course, which is required of every new health certificate applicant. The income will help sustain the operation of the Guam Environmental Public Health Laboratory, and even more so, the recent expansion of the health certificate training course to include renewing health certificate applicants will further increase revenue into the Environmental Health Fund. It is projected that these health certificate training courses alone will generate over $400,000 annually, with potential for additional revenue if the course is expanded to other health certificate categories. Furthermore, with the recruitment of the health educator, the environmental public health officer will no longer be tasked to assist in instruction of these courses and thus allow more time to focus on their primary responsibility, which is sanitation inspection. In assessing the Division of Environmental Health's current capacity and limited success in attaining its metrics, It is important to be reminded that the division responsibility has grown in the last 3 years with the operation of the food lab and the mosquito lab. The staff of Division of Environmental Health, especially its inspectors, are not only performing the duties of a health inspector, a health educator, and at times epidemiologists, and even processing of permits and certificates, but they are responsible now for, that includes laboratory work, laboratorian as a laboratorian, entomologist, and even at times building maintenance personnel, as we'll be responsible for maintaining our environment public health lab. Although the recruitment of 3 vacant positions will not resolve DEH enormous challenges, their impact will be significant to the division and the people of Guam. The need to protect the people of Guam through implementation of all 31 programs, along with the funding of the existing and new staff, should more than justify the proposed FY 2019 budget for the Division of Environmental Health. Senators, it's been said that a picture can speak 1,000 words, and thus we'd like to conclude my testimony by showing you some pictures that we've taken over the years of the inspection that we conducted, which we believe will further justify the points of our division, what we need to accomplish, our potential, and also the funding for 2019. Thank you, and Jesus Masi.
Thank you very much, Mr. Nadeau. Can we send you out to the other departments to give lessons on how to do zero-based budgeting? You've answered all of my questions and preempted all of my, answered even the questions that I was going to come up. There really only was one thing that was not clear to me. You have a capital outlay for something for $35,466. I'm not opposed or objecting to any, but I'm just wondering, that's the same amount that you had last year and I think the previous year. Is there a reason for that amount being the same every year, or has that been purchased or not purchased, or is it a capital outlay that is mandated to be purchased on an annual basis?
Okay. Yes, we did purchase equipment for a similar amount last fiscal year. It just that happens when we do the calculation where we're trying to come to the ceiling that we're established to come with the total amount.
Came up with the same amount.
It just so happens, but the equipments are expensive.
Oh no, I don't doubt that, and especially now that you have the mosquito lab. So you have no quarrel with me on that.
Thank you, Speaker.
You have 4 funded positions that have not been filled.
Yes.
Why?
Well, I don't want to say historically, but I guess that would be a correct statement. And I think I'll speak on behalf of other divisions as well. It takes around an average of 4 to 6 months to recruit a positions. And it just so happened that we're also caught in the recent budget crisis. So there was I believe, a temporary stall in the recruitment. And we just happened to fall into that situation. Speaker.
Okay, because I just wanted clear that we did fund those positions.
Yes, absolutely, Speaker.
And has been, and it's not for lack of support from us.
And it's not lack of trying on our end as well, Speaker.
Okay.
We've
because,
tried.
I mean, after seeing those last photographs, I mean, I understand the importance of this division. Has it been that you guys have just been getting more news coverage, or because the amount of inspections really hasn't gone up that much, but you really are getting a lot of coverage
Absolutely, said Speaker. And I believe that has to do with the result of those inspections. Of the last 33 inspections, inspection of 33 establishments resulted in its closure, the suspension of a sanitary permit. Bulk of that came from public complaints. And we believe, well, we know for a fact that we're getting more complaints than before from the public, which is great. They're being proactive in commenting or forwarding their concerns to our division. And it just so happened those complaints were validated through our inspections and they resulted in the closure. And unfortunately, a lot of those facilities had not been inspected in many years. In fact, the average that we calculated were nearly 5 years that they were last inspected prior to that closure. And one of the reasons they have been inspected as much, at least for these particular establishments, is they do not fall within the high-risk population, or those that cater to high-risk population. Those we inspect every quarter as required by law, and we focus our efforts on those for that reason. Unfortunately, a lot of other establishments are not inspected as often because of our limited staffing.
Okay. Two things. One, I want to commend your transparency in being willing to even state where you have not met your benchmarks and to have as many pages as you have showing where you admitted you've not met your benchmark, and making it look like we should provide more, but I'm just saying we'd like to provide more. We have provided some, and though there are 4 funded positions that haven't been filled, I was going to ask whether it was necessary, but when I see that the benchmarks haven't been met, I don't need to ask that question. But I really do hope, Mr. Casil, that you will assist the division to move their GG1s a little faster down there. It has been funded. So again, I thank all of you for the work that you do. I'm embarrassed to admit that I've eaten at many of those places you closed on me.
33 in the last 8 months.
So, but thank you very much. And again, to all of your entire staff, I mean, this is a really extraordinary zero-based budgeting justification for this, what little support we can provide to you. So
thank you, Speaker.
Thank you for the way that you've managed to make the presentation.
I appreciate that, Senator. I'd like to comment that my staff worked very hard to prepare this document. It's an honor to work to be their leader in the Division of Environmental Health. They put tremendous amount of work in it. They put all their weekends, along with myself, to make sure that we provide you the actual factual information. As you mentioned, we're totally transparent. We make no excuses or lies about our activities. It's available. We provide information to the public and to the media as requested. We've never made it a secret that we are short on staff, but we do the best we can, Speaker. In fact, it's an honor to work with these folks. They're really dedicated, committed staff, Speaker.
That's why I thanked you and them, because I figured it was not just you. So
thank you.
All of them. All right. Your Oversight Chair and then the Speaker. Vice Speaker.
Thank you very much, Mr. Chair. Thank you very much, Tom, and to your staff for being here. Tom, I just have a few questions. You know, we several, I think, or maybe just last year, we passed the incentive pay to retain and to be able to recruit. Has that been successful? Has that been implemented?
Yes, it has been implemented, and I believe it's working. I won't say name, but I believe it helped lure one of the staff that we have currently in our staffing pattern. That individual took a significant pay cut, and I like to believe not just that she wanted to work for a division, but that incentive pay will help offset that difference. And I'll further add that this employee has been truly an asset to the division. It also, because our inability to add additional positions, recruitment, thus promotion for many is far in between. We had one staff who waited a decade to get promoted, but yet she stayed on with the division because of her passion and love for the division. So I believe it helps retain the staff at least. As to recruitment, in addition to the length of the time it takes to recruit an employee, an individual. The applicant pool is limited. We still having to contend with the private sector. And with the recent Hay study implementation, now we're once again competing with the other agencies for the same applicant pool, if you will.
Okay. Okay, and so, so great. So that's covered. You have enough covered in your budget request to sustain that.
Yes.
Okay. The other question I have is, so I didn't think you were here. I thought you were here just this morning, Mr. Casil. But I wanted to ask, during the, I think it was during the Hay study adjustments, right? There was some grievances. I think they're called grievances. Is it grievances that were filed with DOA? And a response came back to the employees about the employees, I guess, sustaining their grievance to the department with DOA. However, what was lacking was the funding to pay the employees what they were due when they were supposed to get paid. That's what I wanted to ask you earlier, and I just slipped my mind. Is that part of your budget request this for 2019?
Not for 2019, Senator. I heard about that. I think this is a government-wide situation because I think this goes back as far as 2014, or was it? Mm-hmm. Yeah. So when we finally received most of the appeals to be resolved, yeah, I mean, the majority of them maybe didn't get the 100%, but they did get. Okay, so that back pay issue, I'll be frank with you. I believe it's a government-wide issue, and it was never included in our budget.
Okay, so I understand it's a government-wide issue. However, one of the departments was able to include that in their budget. I believe it was for 2018. I believe so. One of the departments had included, and so they were paid. And so I'm talking about just public health now, and that there's got to be a mechanism that's put into place. Maybe if you can go back to the administration, yes, and see what can be worked out with at least with your employees, to make good on that, on those responses from DOA. I mean, even if we can be creative and look at some sort of agreement you have with the employees that if we don't have enough to pay them the whole amount, but maybe work on a payment plan that pays the employees back from what is due to them. Because I think right now it's just in limbo, and without seeing it on your budget request, it just pushes the can down the road further. So that's something that I'm going to ask, and Mr. Chairman, if that's something that you would allow them to come back with, at least for your department, to address those employees that are due those compensation.
One of the biggest obstacle from us is because of the federal funding. Of course, if we ask for retroactive, right? Basically, if we were to ask the program officers to use the federal funds, it has to be, I guess, from a budget standpoint and from being austere, is if we can use our current funds, well, we can't because of the amount, right? So technically, I think it has to be a local fund liability and payment. But I mean, if unless we have that extra funding there, we can ask for the budget. Okay, I mean, but in fact, good point is I did request for how much do we owe from DOA. They haven't got to me back yet.
They haven't gotten back
Not
to
yet.
you? So can you please?
But that's in the process.
Okay.
And as soon as I get that, then I could work with the employees that weren't funded,
Okay.
and then like I said, if we get the money somewhere, then we can do it.
Okay,
If we can do it within our own budget, I'll be glad to do it.
Okay, so if you can please bring that back, before the committee wraps up their discussion on the budget, I would really like the committee to be able to review, at least for your department, and we'll talk to the other departments as well, but if you can give us a listing of the employees affected and the total financial impact that's required. Thank you.
Gotcha.
Tom, just one more other question. You're hiring an educator. Is it an education officer?
The official title is Health Educator 2.
Okay, so would that person be the one that would go out to health regulated establishments and kind of provide them what what the laws are, and, you know, kind of like a refresher course. I think we had this discussion a few months back.
Well, he could, but his primary responsibility is to work with the other health educator. 3 is to provide the food safety training course for those seeking health certificates to all 28,000 applicants. So unfortunately, well, actually with the recruitment of the health educator 2, we were able to expand our outreach into the community. Right now, our current health educator is spending most of his time doing the training course, but yet every so often, if resource time permits, he does hand hygiene campaign to the elementary schools, which now include to mosquito bite prevention. But I've always said that we'll do what we can in terms of educating the public, and that still holds true when I last spoke to you, Senator.
Okay, thank you. So this training you do for health certificates, this is something that GCC used to do, or
Absolutely
are they still
correct.
doing it? Or
No, no longer. We have taken over that responsibility. In fact, that responsibility with the division since as long as I can remember, but around 15 years ago, we didn't have the resources to continue on. So that was transferred to GCC voluntarily, which we wanted to. But now that we have adequate staffing to continue, we've done so. But plus, we need additional revenue to sustain our environmental public health laboratory, and that was part of our plan. And it's working out in that respect that we should be able to cover the utilities, which is quite a bit well, it's a lab. But with the expansion of the health certificate program to renewing applicants as well, we're definitely increasing the revenue to the Environmental Health Fund.
So how much is your estimated for 2019 from that fund?
Well, I have a trend graph as to how much on the average year, we generate, how much? No, every year, Environmental Health Fund. Well, whatever that amount is, Senator, we believe additional $400,000 will be generated with the current health certificate training courses of new and renewing applicants. That could be even increased more if we have the health educator to expand into other categories like cosmetic program and for the hotel, motels, and cosmetic program. So if everything goes as planned that we foresee for division, that 28,000 applicants will be easily increased to almost 30,000 and plus in coming years, which should make our Environmental Health Fund to increase it even more.
Okay, great. Thank you very much. Thank you to all of you.
Thank you.
Now you've confused me.
Excuse me, Senator Speaker?
Now you confused me.
Okay.
I was listening to your testimony.
Yes.
And you made mention of your water and power being paid by using lapse funds from previous...
2016, yes.
Yes. And now I just hear you saying that your non-appropriated funds generated by the department is what's paying the power bill now?
We had, in 2016 and 2017, we had budgeted for utilities, anticipating that we'll be moving into the building. Unfortunately, due to challenges by the contractor, we didn't actually move in until June 2017. So during that period, no funds were utilized to pay for water, power, and telephone, even going into much of 2017. It's only recently when we moved in, we are now actually paying for utilities. And we're not seeking for 2019 utilities because we still had the last one, 2016 utilities. So we're utilizing that.
And what was it you were just explaining to your oversight chair about utilizing your education funds, or I mean the fees that you
yes.
generate to pay for your power?
Right. Well, because the health. Okay, first of all, the Environmental Health Fund is through all the health certificates that we issue, including the training that we provide that we've taken over from GCC. So, and one of the reasons we did that was to ensure the sustainability of the lab. So as we have projected to generate just close to $200,000 for the first year, and that was what I guess we identified to pay for utilities. But because we never moved into the building, that money was never really touched, per se, because there was no need to expend for that category. And we're not seeking for 2019 because we'll be using 2016 lapse.
Okay.
I hope I was clear, Speaker.
Well, no, I was listening. I heard it was the lapse from 16, and
yes,
then all
absolutely.
of a sudden it was it sounded like your non-appropriated fee collection that was...
Oh, no, I said we're not
finished to the
speaking for
pile.
2019, Speaker. I apologize if I wasn't very clear.
Okay.
I also want to commend you for the work that all of you have done. This is an excellent presentation. Facts. We love the facts, so I very, very much appreciate it.
Thank you, Vice Speaker.
And for your work that's been getting a lot of public attention, that's great. I think that also helps to educate and prevent, right? We hope.
Absolutely.
But just to follow up on these questions, so you're receiving revenue for not just the health certificates and the renewals, but also for training. That's a separate, I mean, that you charge for that also?
Absolutely, yes.
Okay, and that goes into the Environmental Health Fund?
That is correct.
All of that, and then all of that's used for, and the lapses of that, or you continue to use those?
The Environmental Health Fund has been identified for the sole use of the Division of Environmental Health. Yes,
Okay.
ma'am.
And then, so the vacancies that you want to fill, are these the existing vacancies or an additional 4?
They are existing vacancies.
Okay, so you're not asking for anything in addition to what you got in 2018 as far as vacancies?
No, Vice Speaker.
I see your face is...
Oh, I'm sorry.
No, it's this because of the cap, or you can make do with this?
Well, it's not a secret that we all given a ceiling to, and we'll do the best what we can with the ceiling that we're provided,
All right.
as we always have.
So how many more inspections do you expect the addition of the one person in that category to attain?
With the additional recruitment? Well, on the average, it takes about a year to fully train our staff to do independent inspections. To conduct an inspection, it varies from an hour, like for temporary mobile establishment, to as much as a week for schools. So, depending on the size of the facility and the type of category, it could be, like I said, from an hour to a week. But on the average, our staff can conduct 2.5 inspections within an 8-hour work period. Now, that may not seem much, but if you, as you saw in our pictures, but also the way we conduct our inspections, we're very comprehensive in how we do it, very methodical, and to ensure that all violations are identified and noted. So it does take time, and we do spend a lot of time sitting down with the establishment owners or point of contact going over all the violations. So it's not simply we walk in, cite them, and walk out. We actually spend time there educating, providing them ways to correct their violations. So
right.
How many more? We figured, well, 2.5 times
for 8 hours per week. Okay.
265 days.
Got it.
Working days.
All right, thanks. And this one I'm just curious about. How do you get to be in the high-risk category for inspection?
Okay, those that cater primarily to high-risk populations, such as the elderly, like those that cater food to the Manamcos, or the immunocompromised, like GMH, as well as the children, elementary school cafeterias, childcare facilities. Thank you.
So those are inspected quarterly?
They are supposed to be, and we may not always meet that, but I think we'll be fairly good at that.
All right. Well,
except for school cafeteria. That's a bit of a challenge.
Okay. Why is that?
The lab has, in the past year, the lab has really taken a lot of our resources in terms of time and personnel.
Okay. And then, so restaurants, some of them haven't been inspected for 5 years, but I understand what's going on. I guess, do you have any other recommendations of, I think it's good that you, well, no, that's what I wanted to say, was that I think it's very good that you made it public that a lot of the closures were a result of original complaints by the public.
Yes.
Because I think we have other agencies that are enforcement agencies, and that's exactly how they are operating also. It's because they're understaffed, not able to get out there very often, that they rely primarily on complaints from the public or questions from the public in order to tell them where to go.
Absolutely.
And unfortunately, but I think the more we say that, it's good to admit it, and then hopefully the public will just help us out also. So anyways, I just want to commend you all for your good work. Thank you very much.
Vice Speaker.
Thank you.
Your Oversight Chair has one last question. Oh, it's not third division. Okay. Thank you, and we will start with the next division. I was going to tease you that I guess your education doesn't believe that roach milk is the new superfood.
No comments,
Speaker. Mr. Speaker, can I make a comment too? You know, everyone's been praising environmental health. Well, you know, throughout the years that I've been with public health and even my former director, you know, we've like to also commend them because, you know, they're one least of our worries. You know, they seem to be very independent, and everything they do is in compliance. Anytime I get a deviation from what, you know, sorry. I mean, you know, these are our instructions, and boom. You know, I mean, that's the way it is. We get complaints because of their strictness, but I think after what happened, all the news that's going on, I think people are more aware that what they're doing, of course, is that. So when they complain about, oh, you're inconsistent, you're whatever, I mean, you know, I said, show us your proof, right? You know, those are the basic things I guess we get for those individuals, vendors that don't want to follow the rules. You know, I mean, it's not hard. It's just getting to comply. You know, it's not easy, but of course, when it comes to food and our health, it can't make it easy. So I'd like myself to thank Tom and all the staff here, and I know Lou here. If I call her, go, no, I mean, you know, we have our in-house whatever, but yeah, they're very good and least of our worries. You know, they take care of the program.
Yes. I join you in that commendation.
Thank you.
Thank you very much. Division of Public Health. Senior student. I'm last. Doctor, you may proceed.
Good afternoon, Senator Cruz, Senator Talay, and Senator Rodriguez. I'm presenting on behalf of the Division of Public Health. My name is Dr. Suzanne Kaneshiro, I'm the Chief Public Health Officer. So the mission of the Division of Public Health is to preserve, promote, and improve the health and well-being of populations, communities, and individuals through prevention, education, surveillance, treatment, and regulation. As established by law, the division was established to prevent and control diseases and to promote health on Guam. The duties of the division include the following: to formulate plans and policies to address the health needs of the community, to implement health programs and services to meet the identified health needs of the community, to conduct research and studies to identify community health problems, to provide health service to individuals who are medically and financially in need, to administer grants for health programs and services, to conduct disease surveillance and monitor activities to prevent and/or identify health problems, to conduct health promotion and education programs, to serve as the state public health agency for Guam, to establish standards and regulations necessary to ensure quality health care and the prevention and to control diseases. What specific metric or metrics does public health use to determine the core mission? Monitoring and surveillance, performance indicators and measures, analysis of data systems, program mandates, reduction in the prevalence rate of NCDs, the number of patients served, number of clients registered, the number of patients screened, number of vital records issued, prevention of outbreaks, and account receivables at the community health centers. The funding sources for DPH include the General Fund, the Healthy Future Fund, federal funds, program income at the community health centers, and the revolving fund at the Office of Vital Statistics. DPH is made up of the Chief Public Health Office and 5 bureaus. The division has 31 programs and oversees 21 federal grants. The divisions include Bureau of Communicable Disease Control, the Bureau of Community Health Services, the Bureau of Family Health and Nursing Services, the Bureau of Nutrition Services, and the Bureau of Primary Care Services. So under the Chief Public Health Office, we have the dental program. The dental program is mandated to provide basic dental services to children under 17 and emergency services to seniors over 54 years old. Basic dental care includes exams, prophies, x-rays, sealants, fluorides, restoration, extractions, prescriptions. For emergency care for the seniors, we give them prescriptions and we perform extractions. We also conduct the fluoride varnish program by going to the Head Start centers, daycares, and outreaches for preventive measures. Under the Chief Public Health Office, we also have the Office of Vital Statistics, responsible for registering, maintaining, and storing vital records, issuing certified copies of birth, death, and marriage certificates and marriage licenses, issuing burial permits, also tabulating, analyzing, and publishing statistical reports. Under the Chief Public Office, we also have the marijuana program, responsible for registering, licensing, and regulating medicinal marijuana businesses, i.e. cultivators, manufacturers, dispensaries, and testing laboratories, issuing registry identification cards, authenticating written certifications, registration of patients, primary care givers, and business officials. Under the Bureau of Communicable Disease Control, we have the Foreign Quarantine and Enteric Program, responsible for the surveillance and control of quarantinable diseases at ports of entry, collaborates with federal and local agencies to detect, reduce, and eliminate the sources from which infection spreads and to improve sanitation in and around the ports and airports to prevent the propagation and dissemination of disease vectors. We also have the laboratory services, provides diagnostic laboratory testing to include chemistry, hematology, urinalysis, TB, syphilis, chlamydia, HIV, and hepatitis screening. They also refer specimens to a reference laboratory, for example, at CDC or Hawaii, if we cannot do the testing. We also have the pharmacy services. They provide pharmaceutical services in support of public health programs in the prevention, treatment, cure, and mitigation of ailments and diseases in compliance with pharmaceutical laws and regulations. They ensure that drugs and pharmaceutical supplies procured are of good quality and conform with the FDA, dispense drugs by prescription only, and maintain adequate inventory of essential drugs. So in order to get services at our pharmacy, they have to be seen in-house. Okay, we also have x-ray services. They provide x-ray services for the TB program. X-rays are read by a private provider. We have the Tuberculosis Hansen's Disease Control Program, responsible for the diagnosis, prevention, control, treatment, and surveillance of TB through the provision of readily available screening, case contact investigation, surveillance, treatment, enforcement, and educational services. They also provide TB clearances for school and work. BCD also has the following. They have the Epidemiology Laboratory Capacity Program, HIV/AIDS Program, Immunization Program, and the Public Health Emergency Preparedness Program. These programs are all federally funded. The Bureau of Community Health Services has the Non-Communicable Disease Control Program. They educate the community on the importance of preventing NCDs, such as heart disease, stroke, cancer, diabetes, and asthma, by living healthy lifestyles. They address smoking, nutrition, alcohol, physical activity, and obesity. Through active collaboration with community partners via the NCD Consortium, they promote the prevention of NCDs. The Office of Minority Health promotes the reduction and elimination of racial and ethnic health and wellness disparities in minority communities, including the underserved and underrepresented populations on Guam. Supports and advocates for improved services to marginalized communities such as immigrants, veterans, homeless, LGBT community, people at risk for sexual violence, and cancer survivors. They conduct the culturally and linguistically appropriate services training, which they offer to all the agencies and nonprofit organizations. They also oversee the sexual violence prevention and education program. Okay, under the community health services, also the medical social services provide social work services and assistance to patients and families in resolving their social, emotional, and financial problems related to health care, illness, congenital conditions, rehabilitations in order to promote optimal social functioning. Helps clients effectively utilize health and other support services available in the department as well as in the community. BCHS also has the following programs, which are all federally funded: Behavioral Risk Factor Surveillance System, Breast and Cervical Cancer Early Detection Program, Comprehensive Cancer Control, Coordinated Chronic Disease Prevention Health Promotion Program, the Diabetes Prevention and Control Program, the Racial and Ethnic Approach to Community Health or REACH Program, and the Tobacco Prevention and Control Program. The Bureau of Family Health and Nursing Services has the Clinical Nursing Services, which offers Women's Health Clinic, Child Health Clinic, Walk-in Immunization Clinic, Family Planning Clinic, TB Clinic, and STD Clinic. They also have the Medical Records sections responsible for the storage and security of patient medical records, responsible for the registration of patients seen at the Central Medical Clinic. We also have Project Carino, this Early Childhood Systems of Care initiative, using a public health approach for children birth to 5 years of age, provides screening, assessment, mental health promotion and consultation, family education, individualized services and supports. For young children, this is for young children with social, emotional, behavioral, and developmental health challenges, i.e. difficulty in learning and getting along with others. Other programs which are 100% federally funded is the Project Visita, which is an early home visiting program, the MCH program, and Project Launch. We also have the Bureau of Nutrition Services, which which oversees the WIC program and the Preventive Health and Health Services Block Grant. Bureau of Primary Care Services oversee the community health centers. They provide primary care services to underserved, indigent, and uninsured clients living on Guam. They offer adult care, women's health, adolescent health, child health, early periodic screening, diagnostic testing, vision screening, and many others. Okay, so Table 1 is the funding source for the Chief Public Health Office and the Bureau of Communicable Disease Control. So I broke it down into programs, and it tells you their funding sources. So tables 1, 2, and 3 does that for all the programs, so you can see where the funding sources are. The pie chart 1 is the DPH salary funding sources. So the general fund contributes 9%, the Healthy Futures is 22%, and for federal funds it's 69%. And so the figures are on the right. For tables 4, 5, and 6, it tells you the breakdown of the general fund which each program receives, the different categories, salaries, rent, contracts, supplies, medicines, and utilities. So I have the breakdown for all the programs, and then it aggregated in the division. For table 7, it has the breakdown for the general fund and the Healthy Futures Fund for each of the programs. Okay. For the pie graphs, you can see on the left the general funding allotment. The bulk of it goes to BCDC, the Communicable Disease Program, which is 40%, followed by the Bureau of Primary Care Services, which is the community health centers at 26%, followed by the Chief Public Health Office with 17%. For the Healthy Futures, most of it goes to the community health centers, the 62%, followed by the nursing program, 20%, and then the CPHO, 15%, which has all the dentists. The next pie chart is for the general funding categories, which breaks it down to various categories. So the bulk of the GF goes to salaries, which is 49%, followed by supplies, 24%, and contracts, 21%. Currently, there are 23 employees funded under the general fund and 45 under the Healthy Futures Fund. Under vacancies, there are four under the general fund and 3 under the Healthy Futures Fund. So in Table 8, it tells you where the vacancies lie. So there are 2 in the TB program under the general fund, 1 in Project Carino, and 1 in the Community Health Center. Under the Healthy Futures Fund, we have 2 vacancies in the clinical nursing services at the Central Public Health, and 1 in the Community Health Center. So for the next slide, I'm going to have Josie O'Malley, who is the administrator for the TB program, to talk about the slides.
Good afternoon, Speaker, Vice Speaker, and Senator. My name is Josie O'Malley, and I'm the administrator for the Bureau of Communicable Disease Control. The TB program is responsible for the diagnosis, prevention, control, treatment, and surveillance of tuberculosis through the provision of readily available screening, case contact, investigation, surveillance, treatment, enforcement, and educational services. The program also provides diagnostic radiographic support services and TB clearances for school and work. TB is a highly contagious disease. The transmission of TB must be prevented. The TB program has only 8 staff to conduct TB investigation and perform direct observed therapy program. But in addition to that, it also, provides daily screening of health workers and students for clearance, as well as x-ray services. There is 1 full-time physician and 2 nurses. And these nurses that support the physician are cost allocated and also support other clinics, in addition to seeing TB patients. Guam's location in the Western Pacific puts it at high risk of TB exposure, especially for multi-drug resistant TB and extreme drug resistant TB, which are cases present in the Pacific region. From 2013 to 2017, there was a 42% increase in the number of reported TB cases in Guam. The TB incidence rate in Guam per 100,000 persons continues to be over 11.5% higher than the overall U.S. rate and over 3.5 times higher than Hawaii, the state with the highest TB national rate. So in the next slide, it shows you the breakdown for 2015 to 2017 in regards to the age of those diagnosed with TB that were actually provided services. And just an explanation as far as multi-drug resistant TB as well as extreme drug resistant TB. And basically it's resistance to the standard medication regimen that is used. And individuals can develop resistance by not taking the medications as prescribed or actually being exposed to someone who has that strain of TB. So in the next slide, for Guam, we're having, unfortunately, more individuals present with multi-drug resistant TB. As you can see, in 2014 to present, we've had 10 individuals classified as having multi-drug resistant TB, and of those cases, 2, unfortunately, were diagnosed with pre-extreme drug resistant, which is very concerning because Guam is the first in the North and South Pacific region to actually diagnose such cases. And the treatment of pre-XDR is so much more expensive. In the next slide, it shows you with the regular TB, we're looking at $1,800 to cure. For a multi-drug resistant case, we're looking at $154,000 to cure. And then extreme drug resistant, which we don't have yet, but we do have pre-extreme drug resistant, you're looking at almost $500,000 just to cure. It's very, very challenging. It's labor intensive. It requires really efficient, monitoring and follow-up with these individuals because you're talking about people having to take toxic medications for 24 months. It's a long time. There's side effects and their, side effects can be very extreme that really results in someone just wanting to give up. So it takes a lot of, again, human resources, to actually put into that, those few cases, but also in regards to conducting all thorough investigations, to identify all who may have been exposed. The two vacancies that we were, that actually we were able to request funding for is to get additional support service in the clinic. We need dedicated nursing positions. We, at least one more community health nurse, which is included in our request, and as well as a licensed practical nurse. A community health nurse, dedicated one, would actually support case management and provide the needed clinical support and guidance to those out in the field. We have workers going out daily, giving medications to those individuals who are being treated, and there are many often clinical questions that need a nurse or the doctor to respond to. So having someone dedicated, is truly needed, as well as a licensed practical nurse who could actually support screening, with the number of cases that we have and the requirements to do skin tests, to identify additional cases. Our clinic is really lacking in nursing support, and so it is critical to our prevention and control efforts to get these two positions funded and recruited.
So the next following slide is going to be from Margarita Gay, the Administrator for the Family Health and Nursing Services.
Margarita Gay. I'm the Administrator for the Bureau of Family Health and Nursing Services. The BPHSS nursing staff has several clinics at Central Public Health, women's health clinics that take care of the prenatal and postpartum women, child health clinic that offers clinics for well baby checkups and special kids clinic needs, and hearing testing with immunization. Our walk-in immunization clinic provides children with immunizations from 0 to 18. Our family planning clinic, our tuberculosis clinic that we work with the Bureau CDC, and we have our STD clinic and our pregnancy testing clinic. Our nursing clinical services are within the 5 months. 2 of our community health nurses have retired. The number of community health nurses at Central Public Health have steadily been declining. In 2015, we had 15 community health nurses, are also called RNs, and in 2017, there was only 7. And currently, at this moment, there is 5, 3 within the clinic, and then 2 from Project Visita. The shortage of registered nurses have led to the discontinuation of the district nursing, in which the nurses were able to go to the homes of the clients who were unable to come to the clinic and conduct health screenings, assessments. And so we may not feel it before those, but we were out there in the community, home visiting prenatal patients, STD clients, and families that needed our support, where we were able to go to their homes and provide education to them, and also care. And so also, with the services in the medical clinic, it's either been reduced or eliminated. Our walk-in immunization clinics are now once a week with a maximum of 24 patients during that clinic. Previously, we were able to provide immunizations for three times a week. And this is going to further reduce the number of children that who will be immunized throughout. So this is created a big problem for parents when they are trying to enroll their children into school in the new school year. In the past, the department would be able to conduct these walk-in immunizations at a month before school starts and from Monday to Friday. But it is impossible for us to do it this year. Further on with our services, the probability of the outbreaks in the community increases because there are more children who are not protected against preventable childhood disease. And the key to a healthy child is getting immunized because of the communicable disease that not only on Guam, but it's also around us in our other islands. And so there is currently measles outbreak in the Philippines, about 598 cases. And since January 2018, there is a mumps outbreak in Hawaii with about 970 cases. So people are traveling back and forth, and our children are at jeopardy in getting these diseases. And so the medical clinic at Central Public Health has reduced the number of pregnant women who can be seen for their prenatal care services because of the lack of nurses. A few months ago, the medical clinic had 2 nurse practitioners, seeing pregnant women for prenatal care. One nurse practitioner worked twice a week, and the other nurse practitioner worked 4 times a week. And so each nurse practitioner was able to see 12 patients a day, but because of the shortage of the nurses, the nurse practitioner is not able to continue. So she has reduced her hours also because they need to also work with the nurses. And so the number of patients have been down. We were seeing 72 patients before, but presently we went down to 48 clients. And the pregnancy rate is growing. As you can see, our population is growing, and we have the providers, but we need the nurses. The lack of prenatal care can lead to preterm labor and delivery, labor complications, and low birth weight babies, and infant mortality. Currently, our infant mortality is about 12.9. There were 41 infant deaths on Guam in 2017, and a majority was due to the lack of prenatal care. There are currently 50 to 60 pregnant women being seen at Central Public Health Clinic. Most of them are with no health insurance and have no medical, and who cannot afford to pay for prenatal care. Pregnant women who cannot be seen at Central Public Health choose to forego prenatal care. Services at Central Public Health are free. So if they know that they're unable to see us, they may, because of priorities, they may choose to not see at all anyone due to the cost. So our pregnancy testing, which we also provide, and early prenatal care classes are being reduced as well. Women who suspect that they may be pregnant and cannot be seen at Central Public Health, they do not have medical insurance, will have to buy their own home pregnancy test, which is about $20 to $30 to confirm their pregnancies, because we have reduced from 10 for twice a day to now 6 for 2 days. So from 20 to 12. And so we do not know that some women will not know if they're pregnant, but they will seek but they will not seek timely care. And so that's one of our services that have been limited. And so prior to April 2008, the medical clinic at Central Public Health was conducting 2 TB clinics, as Ms. O'Malley has mentioned. The CDMD clinic, which is where they see the doctor, was staffed by a physician and a registered nurse. And then the other clinic is the CDNC, which is staffed by a registered nurse. The CDMD clinic and the CDNC clinic are each treat 52 clients a day. As of April 30, 2018, only the CDMD clinic will be conducted because of the lack of nurse. If the medical services continue to be reduced, it may jeopardize more federal funding because of the grant mandates that will be affected, will be not met. There were 2 funded vacant positions under the Healthy Future funding. And so if the medical services continue to be reduced, it may jeopardize our federal funding with the mandates. And as you can see, there is our vacant CNH2 that we lost 2 community health nurse, 2 positions for retirement just January and April. And so we are, as you can see, they with all the clinics that I've mentioned, these are the nurses that need to be part of that clinic to continue our services with all the, with all the different grant programs that we have, our TB, our immunization, our pregnant women. And so, as you see, we also need, okay. So, there's other positions, but they will continue. But we used to be, the thing with our nurses is the district, we're not out there, but they still look for us. And so our education, our prevention, which is our mission as a public health nurse, is not being there. And you can see as there's prenatal problems, there's infant problems, there's children, and that's what we need to continue our public health nursing to prevent the diseases that we are preventable. So the next one. Sorry.
So another vacant position we have is with Project Carino. And so Ms. Pauline Camacho will talk about that program.
Thank you, Dr. Kay. Good afternoon, Speaker Cruz, Vice Speaker Terlahi, and Senator Nelson. Thank you for having us here this afternoon. I'm Pauline Camacho. I'm the Acting Social Service Supervisor 1 with Carino. And just a little background, we had Project Carino through a SAMHSA grant for 5 years with one no-cost extension year. And then to sustain that program, we had Project Launch to continue those activities. So Project Carino has since ended, and with the Project Launch funding, we've morphed the 2 groups and just now call ourselves Carino. And we lost our Social Service Supervisor 1 a year ago, October 2017, our good friend Terry Uggan. And so through our acting director, he's been graciously filling that position with 3 different staff in an acting capacity each month. So we are tag teaming, and we're doing a team leadership way of carrying out and conducting the program. So we do have this 1 vacancy for this position, and as stated on the PowerPoint, the supervisor position is necessary to provide supervision to the other social workers in the program as well as in medical social services. The social workers cannot practice without proper supervision. The other duties of the supervisor include providing psychosocial services to children and their families, providing direct guidance for the services planned and implemented that meet the needs of young children and their families who are involved with multiple child service agencies. And 3, reviewing policies and procedures for a client record filing system that account for all referrals to Crino, which includes referral forms, assessment tools, progress notes, individual service plans, and the proper storage of these records using HIPAA guidelines. And so this position is vital. If an adult has a mental health concern, they would go to Guam Behavioral Health and Wellness Center. If youth or young adults have issues, they would go to Ifamaguanta. But babies, infants, up to age 5, young children, the only real place for them to go if they have social, emotional, behavioral, or I would say mental health concerns would be our Carino program. So it's vitally needed. The judicial system constantly has CPS send the children to our program. We are out there in the schools helping children and overseeing any behavioral, social, emotional, or mental health concerns for children.
Okay, so last position is in the Bureau of Primary Care Services at the Community Health Centers.
Good afternoon, Senator B.J. Cruz, Speaker B.J. Cruz, Speaker, Vice Speaker Therese Terlahi, and Senator Talina Nelson. My name is Linda Pinco Denorsi. I'm the Community Center Chief Executive Officer. I've been in that position for 20 years. And of course, you know that primary health care is so critical. It is what prevents people from going into the emergency room. So theoretically, we really move them out of not trying to go to GMH. We keep them out. And physicians, specifically for primary care, are fewer and fewer. Why? Because a lot of these doctors that go to medical school, they want to go into a specialty, like, for example, cardiology and ENT, ear, nose, and throat, and so on and so forth. Why? Because there's a lot more need for specific types of medicine in that area, and of course it pays a lot more than a primary care doctor. I think the bottom line is money talks, right? And so a lot of them really have a difficult time going into primary care, such as the FQHCs or the federally qualified health centers throughout not only on Guam, but throughout the United States. There are thousands of community health centers that have this problem. Specifically in Guam, I'm happy to report that in 2017, we hired 4 full-time physicians. That was really difficult to do. 2 of them were from off island, aggressively recruiting. One was through the National Health Service Corps. This is a special federal program that entices patients or newly graduates of medical school to work in a health professional shortage area such as Guam. We qualify, and we've already recertified our health centers for the next 3 years. And so they come to Guam, and so one of them was our doctor that came, and although we hired 4, we also managed to get a nurse practitioner that was working at our health center to go to nurse practitioner school, and she graduated. And then we have another nurse practitioner that recently finished. And again, the salary is always an issue, especially working in the Department of Public Health. And for this reason, we have made the step a lot higher. And that is the reason why it's about $130,000, just the salary base, and then the fringe is about $40-some thousand to equate to $180,800, because there's no way we're going to recruit at step 1. It's just totally impossible. And we really have another issue because a lot of our private clinics on Guam, they don't mind accepting Medicaid MIP patients as long as they're established patients. The problem is when they're new patients, newly diagnosed, or they're patients that just have been enrolled recently, That's where the problem is. And the question is, why is that happening? I can give you a whole slew of reasons. One in particular is because the reimbursement rate is kind of slow and low for Medicaid and MIP. Most, of course, providers would prefer privately insured patients. So where do they go to? They go to the health centers. We are the safety net providers for the uninsured, the medically underserved, and the low-income population. And so maybe that could be your question, why is it so high at 180,000? There's no way I can recruit, as I mentioned, at 125,000. That's even at step 5. And most of our doctors right now are already above step in order to even recruit. We only have one full-time doctor that is a permanent physician. And he's been with me for the past 20 years. You know Dr. Weir. The rest, I simply just can't recruit using the staffing pattern that it currently exists. Even though the Hayes study was implemented, they left out the providers. Don't ask me why, because I don't have an answer for you. It's what DOA did. But we approached Senator Rodriguez, and the board has mentioned this as a big issue, that we need to do something with the physician's pay scale because it's far below the national rate. And of course, it came at a very bad time when we're talking about furloughs and all this and that, so it was kind of like put on the back burner. But the board approved a new scale that we were going through. But at this point, it's at a back burner. But let me continue forward. The other area that we want to recruit through our general fund position is a dental health specialist. Of course, Dr. Kaneshiro, our Chief Public Health Officer, is also by profession a dentist. She has mentioned earlier what the dental program does. We work hand in hand very much with the dental program. And so we're partnering so that we can achieve one of the HRSA performance measures, which is to do dental sealants. And that is required for HRSA. And that is why we need a dental health specialist to assist the dentist, which is Dr. Rapadas, our dentist at Public Health, to do this type of sealant treatment at our health center. And so that's why we really need to recruit this position. I hope that's justifiable.
So in conclusion, the Division of Public Health is requesting for, under the general fund, $3,437,498. Under the Healthy Futures, we are requesting $4,326,741 for a total of $7,764,239. The department is requesting that all the vacant positions remain funded so they can be recruited in order to alleviate the workload placed on current staff and to help patients get the service they seek in a more timely basis. Thank you.
Thank you very much. And I think we have to go with this last comment. When you were going through all the nurse shortage and the making it sound, and it sounds very dire, please be clear. Those are funded positions. Am I correct?
Correct. The thing is, they're not attractive, I guess you can say. We compete for nurses with GMH, GRMC, private clinics. So usually when the new nurses graduate from, for example, UOG, they prefer to go to the hospitals or to the clinics because the pay is much better. So even though we offer these salaries, they're funded, it's just not attractive enough, I can say.
And so how can we make them more attractive? But first, I just want it very clear to the public that we have in this past fiscal year, this current fiscal year, funded these positions, and they have been vacant for how long?
At least 2 years. At least 2 years for the dental health specialist. It's been a while, because those are actually 100% locally funded positions. So over the years, we've actually lost a lot of the dental health specialists. As I say, it's still, the salary is low. It doesn't attract anybody. Because we've had a continuous announcement for the past 2 years for a dental health specialist. And it's just not attractive. And
Okay,
so,
I understand, but have you put out recruitment notices?
yes, it's continuous.
It's
Yes.
continuous.
Yes.
And the situation has only gotten worse. I see we've gone from 8 nurses to 5 nurses, and it's exacerbated the problem, and now we have children that aren't going to be vaccinated, which reminds me, I want to congratulate you for your national recognition and commend in spite of all this, you've still managed to get national recognition, and so we commend you for that. But please talk to your oversight chair and try to figure out how it is that we can try to do something. I too do not understand how you could have left, or they could have left them out of the hay to increase their salary. I'm trying to figure out how the public health nurses could possibly be paid less, because if memory serves me right, it was a public health nurse that sued the rest of the government to get equal pay for everybody else. And so I'm trying to figure out how it is.
For the community centers, we just recently recruited a nurse just a couple months ago. The way we do it is we go at above step. That's the only way. There's no way we're going to make it at step 1. That's how we get through it. For Margaret's bureau, she can answer for her bureau, but for our bureau with the community centers, I can't recruit at step 1.
Okay, well, fine.
Yeah.
It's funded, and you just
Yes.
you do what you need to do
Exactly.
within the
law.
the law,
Yes.
and do above step. But
Yes.
we need to do whatever needs to be done to hire those nurses, because I want it clear to the community, these were funded, and you can do something, and so please do something, because as you read through that, my 2 colleagues were looking at me like I was the ogre of the earth that didn't provide for it, and I kept saying, no, it's funded.
Speaker, for the community centers, we hired at above step. What helps us is our program income funds that are able to provide us that revenue to hire at an above step. So that's what's been helping us tremendously. Those are the funds that we collect from the patients, the payer sources, the Medicaid, MIP, Medicare, private insurance, self-pay.
And I know that Mr. Casil and Senator Rodriguez were creative, and they have a special fund for, you guys provided additional money for a doctor that was in their budget, we discussed earlier today. So can you figure out something that you guys need so that we can get these nurses, because it really is imperative. And when you go through and you read these last 10 slides, and I'm like, we funded those. So anyway, but thank you very much for, because that answered the questions. There was one other question that I had. You have a $99,000 security guard services. Is this separate from the one that you have in your division? Or I thought this morning when you talked about security, you said it was for the office and for Central, or is this your contribution?
Well, actually, it's for the 3 health center sites, the Northern, Southern, and Central, that we're able to fund security guards, sir, because we really need that. We had one case where a patient came in with a machete right about to hit another patient, so it was just so alarming that we couldn't take a chance. We had several incidences where a patient was actually stabbed and bleeding, and
I'm not opposed to it.
Yeah. So,
and it's
so
very,
it's for all 3 sites.
It's very needed. I just needed to know whether or not it was separate from the one that I asked him about earlier, and you've just made it clear that this is for your 3 centers. This morning, it was for his central office and the clinics. So that's clear.
To clarify, right, the bid to acquire the services are to cover the 3 facilities, but this cost is cost allocated. We still pay for a portion of the north and south because we occupy the food stamp section. We occupy WIC. We occupy. WIC. They all have offices.
Yeah. No, I have no problem with it. In this day and age, unfortunately, I mean, thankfully, knock on wood, yet we haven't gotten to that other insanity, but just really seriously, I'm fine with it. And you've done an excellent job with this 28-page presentation on zero-based budgeting. Again, you guys have proven you have the best administrators and division heads and understand English when I say I need justification. So thank you very much for how well you've made your presentation. But I don't see any other question that I really need to ask, but I just wanted it very clear to the listening public that the nurse positions that you were making reference to were the funded vacancies that we somehow need to try to figure out how to attract and entice more people to assist in those areas. Would it be possible to have an LPN do some of the nurse things for the immunization, or does it need to be an RN?
It can have LPNs also. We can look at positions to add to the.
So would that be more attractive for them if you did it, if that was who you hired instead of hiring an RN?
Yeah, because before we used to have 5. They were running the clinic, and so what the others had is they got promoted by passing their RN, and so it would be an attractive area for LPNs.
Well, that's why I asked the question. It seemed to me that somehow, yes, RNs are in high demand, but there are LPNs, and I'm wondering whether or not we could do that again. Start them there, and if they pass their NCATs, then God bless them and let them move on. But then we are turning out quite a few at GCC, so.
Yeah, because the ones that we just requested is because of the retirement. The 3 nurses that retired.
So let's again, Leo, I'm looking to you to assist move these through as quickly as possible, because when they describe the dire health consequences, it really undermines your entire mission when you can't address them. So try to help them move it through. Don't fight their above step, and don't be opposed to their LPNs.
Yeah. Speaker, may I say, we do a great job moving the paper through. Once it leaves our department, Leo has been really good as far as signing it off and getting it through. The problem is when it goes down to Department of Administration, it's beyond our control. That's where the bottleneck is at. And I
jumped them last week.
We resubmit every year, same thing, every year, every time, same story. Still pending, still pending. Fortunate enough, I just got a text that I'm recruiting 2 more positions, so I'm really shocked. That was about more than a year ago.
Yeah.
But it's moving, but very slowly.
Yeah, no,
we do a good job.
They missed my analogy last week when I said they were the kidney. And if it's not properly moving through, then we'll have amputation soon or renal failure.
We follow up, and then we're told we cannot call anymore. So what do? We tell our boss says, give us the paper again. We give the paper again. Same thing, goes through, Mr. Casil goes down, and same story. So we're doing our job as far, and our director too, to make it happen, but it's beyond us once it leaves our department, just to let you know.
No, we had that discussion with them last week, and they just... Vice Speaker.
Thank you. Yes, I was alarmed while I was listening to your presentation, and Speaker was signaling me, no, these are all funded. So all of the positions, particularly the nursing positions and the physician positions, these are funded currently. We just got to get them filled. And so you're only asking that these current funded positions be continued next year. All right. That seems like it's got to be able to happen, right? I mean, okay. Yes, this is critical, I would imagine. I can't imagine anything more critical than what you've described here. So I did only have one question. When you said that, and I think we need to do it like within a month because school starts soon and you're going to have a huge demand, we hope, right? We want a huge demand for the TB screening and all of that, and schools are going to require it. It's just going to be a big mess. But can you just explain this about the nursing clinical services? The nurse practitioner was discontinued because of the shortage of nurses.
Well, they're both part-time and they're contracted, but one nurse, well, both nurse practitioners were able to work the 4 days with 1 or 2 clinics a day. And because I don't have a nurse to assist her, she had to cut her hours to 2 days a week.
Why is that? Why can't they work without the nurse?
Because we only have 3 on board right now, and one, like we said earlier, the TB needs 2, and then we have MCH, which deal with pregnant women and child health, and so we need a nurse to each provider or each clinic to, to follow her orders and do, see them after and see them before, and so. She just lessened them, but as soon as we get another nurse on board, she will come back. But we didn't discontinue, I'm sorry. We limited her days.
So the nurse practitioner cannot or will not see patients unless there is another nurse there?
No, they can see, it's just that we're not going to see all the patients that we used to see because we need the nurse to, because our public health nurses, you see a nurse in the beginning of the appointment, and you see the provider, then you see another nurse, which is an RN usually, to do the teaching and get the follow-up and educate her on what the patient needs, and so that's how we do it. They're able to do the services with the different nurses on board, but. Maybe we need, it's just overwhelming. If you see 13 patients and only 1 nurse to assist both nurse practitioner, but again, we'll consider the LPN, and they can also assist with the clinic.
All right,
so.
And if you have any other ideas as to how to prioritize the public health to make it able to recruit what you need. I understand you're competing with GMH. When GMH is in here, they swear that they are the ones who are competing and they can't recruit nurses. They say that to me over and over.
Senator, we do have a way to address that. What we do is we do a lot of preceptoring for the University of Guam students.
What do you call it?
Preceptoring. When they're in school at the University of Guam, we partner with UOG so that we have the nurse students come to our site as a practicum, so that we can get them in ties to work in a primary care setting such as our community health centers or the Department of Public Health. And so that has really greatly helped. In fact, We hired about 5 of them from the University of Guam because of our preceptoring. And we also do that also for off-island physicians and nurse practitioners, the students that are in the nurse practitioner programs from off-island that are local Guam people.
Well, great. So. Great. Thank you very much. Thank you all for your hard work. And,
Thank you.
And I was telling her, I think most of these women have dedicated their entire careers to this same job that they are in right now, right? And so
Yeah.
it's very remarkable, and thank you very much.
Yeah, thank you.
Thank you, Mr. Chair. I just have a quick question. Thank you, all of you, for your continued hard work. And the speaker was commending you on your recognition, and I said, well, because it's run by women. But I do have a question. In the nursing clinical services on Community Health Nurse 2, are these specifically the 2 positions that you need to maintain this federal funding? Or are there more positions that you need to ensure that you continue to receive the grant?
They're needed for our federal funding, but it's also because it's under local funding. Yeah. So our other grants do cost allocate some funding to the nurses.
No, because I was a little bit worried because it says it may jeopardize future federal funding because grant mandates. So I was just wondering.
Yeah, but our grants are right now because of the shortage. We won't be able to have the funding all used by, the end of the grant period. And so the recruitment is very, very, very critical for us to hire because we need our federal money to spend also. So it is needed for our grants.
So specifically these 2?
Yes.
The community, and then the recruitment, you're going to increase the steps so that you can become more appealing? Okay.
Yeah, just to share, we had an opening for our Project Visita for a nurse. Never did I ever have 4 applicants, and 3 were able to be there. And if that's what's happening, that's what we need. And so their nurses are out there. It's just, like Linda said, it gets stuck after our department. It does. And we had to ask one nurse to wait almost a year. I said, please don't forget, just hang on.
Is it because it's stuck at DOA?
Yeah, it was. She was. The announcement took a long time, and then the rating took another more months. And so finally, when we interviewed her, it was almost a year. And so we were just happy that she stayed on to wait for that position.
Okay.
But, yeah.
Thank you very much.
Was there the Vice Speaker would like a date stamped GG1 on how long these 8 positions have been sitting at DOA. Okay? I understand that they're funded, and so that part but they want to know why it's taking so long, and so if we can get a date stamp on when it was taken there, we can call them back and say, hey, this is unacceptable. In other places you can play this little game, but when little children's health are in jeopardy because you're not moving it through fast enough, it's unacceptable, if not criminal, as far as I'm concerned. Okay? So again, thank you very much for all that you do. Congratulations on your national recognition, and keep us on the map, not as the highest TB rate, but as the best immunization program, anything that looks good, but the bad ones, please don't. We no longer want to be number 1. There's some things that I could do without. All right, thank you again very much.
Thank you, Senators.
Good afternoon. There was a method to my madness. I told you guys this morning that my scheduling was not off. I just didn't want you to sit here since 9 o'clock this morning.
Good afternoon, sir.
Because I'm sure there were other more important things for you to do. But we're now with the Division of Senior Citizens. And so, Mr. Snogstein, you're recognized to do the presentation for the division.
Well, thank you very much, Mr. Speaker. Good afternoon, Mr. Speaker, Madam Vice Speaker. This afternoon, I will be opening the presentation for the budget request for 2019 for the Division of Senior Citizens. Also present and eventually will join us is our Acting Director, Mr. Cassill, and our Administrative Services Officer, Mr. Tom Tidegly. If I could ask each of my program team, my management team, to please introduce themselves.
I'm Charlene St. I'm a Program Coordinator 4. I'm with the Bureau of Program Administration and Development.
Good afternoon. I'm Jocelyn Cruz. I'm a Social Service Supervisor for the Bureau of Adult Protective Services.
Good afternoon. Chad Palomo, Program Coordinator with the Bureau of Community Support. I'm sorry, Chad Palomo.
Mr. Speaker, I'd like to start off by sharing the mission of the Division of Senior Citizens. The mission of the Division of Senior Citizens is to plan, coordinate, implement, and evaluate programs and services, and to identify and leverage all possible resources towards promoting, maintaining, and protecting the total well-being of older persons while safeguarding their dignity, integrity, independence, values, and cultures. Let me start off by sharing some very general overarching key activities of the Division of Senior Citizens. One of the key activities, which I really call our marketing arm, is information referral and assistance. This area navigates through the maze of services out in our community to help our clients, their caregivers, and families make informed decisions. There is also protection and advocacy, and this is the area of our division who protects and safeguards the interests of seniors and adults with disability who are victims of abuse. And then there is our home and community-based services program. This program promotes and maintains services so that our seniors can age in place and live with dignity and integrity. In terms of the specific metric or metrics that the division uses to determine that our core mission is being achieved, there are several metrics that we use. In our contracts, we have the annual client satisfaction surveys, we have program audits, desktop monitoring, we respond to complaints and concerns. There are also predetermined established workload outputs, either through the budget or through grant. There is also the invoice tracking. We have monthly program reports checklists, case assignment and tracking. We also have the State Health Insurance Assistance Program tracking and reporting system, the Senior Medicare Patrol Project Information and Reporting System, the National Adult Maltreatment Reporting System, and the National Aging Program Information System. The organization of the division, it starts with the State Office on Aging. There's also the State Agency on Aging, and there are 3 bureaus in the State Agency on Aging: the Bureau of Administrative Support, the Bureau of Community Support, and the Bureau of Program Administration and Development. We also have a 4th bureau in our division, and this bureau became part of the division's work activity in response to the identified need to investigate cases of abuse against our elderly and adults with disability, and this is the Bureau of Adult Protective Services. For the fiscal year 2019 budget, the department's request is $55,408,408. And for the Division of Senior Citizens, our part is 16%, or $9,142,902,000. Of the $9 million earmarked, or 16% for the Division of Senior Citizens, 12% is earmarked for personnel. That's $1,085,096. While 88% is earmarked for operations, or $8,057,806. Of the $8 million for operations, thank you, $7.8 million is earmarked for contractual services, which is really 86% of this categorical funding. Also, to further discuss the 7.8, of the 7.8, 7.6 is earmarked for our home and community-based services, such as adult daycare, case management, in-home services, legal assistance services, senior center operations, transportation services, our elderly nutrition program, Congregate, our elderly nutrition program, Home Delivered, the National Family Caregiver Support Program, and Guma Serenidad. This is the emergency shelter for adult victims of abuse and adults with disability. The Division of Senior Citizens in the current year is funded with 18 staff, 18 personnel, and in terms of who is currently, or what is currently filled, we have 10 positions that are currently filled in the Division of Senior Citizens, and the value of that position, of those 10 positions, is $613,421. Starting with the State Office on Aging, there are 2 positions. The amount there is $45,562, and it may seem rather low for a general fund request, but that's because both positions, the Senior Citizens Administrator and the Administrative Assistant, are matched positions. It's local federal, so the difference there is covered by federal dollars. The other general fund request is for the Bureau of Adult Protective Services, and that's for the next 3 positions, and that's Social Service Supervisor 1 and 2, Social Worker 3s. The amount for the positions is $206,839,000. Under the Bureau of Community Support, 2 more additional positions are filled. That is the PC4 and PC3, or Program Coordinator, for an amount of $133,710,000. Our next Bureau, the Bureau of Program Administration and Development, the last 3 positions, rounding it up to 10 filled positions, is at a value of $227,310,000. That is comprised of a PC4 and 2 Program Coordinator 3s. The total value, again, of these 10 filled positions is $613,421. In terms of the 18 positions, the 8 vacant funded positions, the value of those 8 vacant funded positions is $471,675. And those positions are as follows. Under the State Office on Aging, that's a Management Analyst 4 at $20,245 for the General Fund. Also, this is one of the positions that has federal dollars, and so it's cost allocated. The General Fund also is asked to, for 2019, the Administrative Officer at $52,913. The Bureau of Adult Protective Services, a Social Worker 3 at $65,891. And then the Bureau of Community Support, 2 positions, a Program Coordinator 3 and a Customer Service Representative. And the value of those 2 positions, $115 and $70. And the last Bureau, Bureau of Program Administration and Development, has a Program Coordinator 4, a Program Coordinator 3, and another Program Coordinator 3 for a value of $217,556. So the 8 vacant funded positions is at value of $471,675,000. So at this time, Mr. Speaker, I would like to have Ms. Cruz, who is the supervisor of the Bureau of Adult Protective Services, continue the presentation on the more details of the Bureau of Adult Protective Services.
Thank you, Art. Good afternoon, Mr. Speaker, Vice Speaker Terlahi, and Senator Nelson. My name is Jocelyn Cruz, and I'm the Social Service Supervisor for the Bureau of Adult Protective Services. As Art had mentioned earlier, the Bureau of Adult Protective Services, or BAPS, is the protection and advocacy arm of the Division of Senior Citizens, whose core mission is to provide protective services to the elderly and adults with a disability in a manner that is least restrictive with respect to their dignity and in consideration of the values and practices of their culture. The Bureau of Adult Protective Services serves the taxpayers through the enactment of Public Law 31-278 on December 28, 2012. Guam's Adult Protective Services mandates, Public Law 1954 and 2133, were updated and created within the division, the Bureau of Adult Protective Services, whose mandated responsibilities are to receive and investigate at a 100% performance level reports of suspected abuse or neglect against an elderly, 60 years and older, or adult with a disability, 18 years and older, which includes but is not limited to reports of abuse in facilities operated by the department and other public or private agencies and in private residences. APS is also mandated to provide crisis intervention in situations where the victim is in immediate or imminent danger, and to coordinate for the provision of protective sheltering and/or protective orders to be secured to prevent further abuse of the adult victim. We are also mandated to complete investigations within timelines and prepare declarations to the Office of the Attorney General on substantiated cases of elderly abuse and abuse against our disabled adults that merit the review and consideration of the Attorney General's office. We are to provide a 24/7 protective shelter for abused elders 60 years and older and adults with disabilities 18 to 59 years who are in imminent danger of further abuse and require temporary protective sheltering. Provide a 24-hour, 7 days a week crisis intervention hotline. Our responsibilities and duties also include to administer and monitor contractual compliance of the contracted service provider for the provision of protective care and services, which includes the management of a 24-hour, 7 days a week protective shelter, namely Guma Serenidad, which is equipped with a 24-hour crisis intervention hotline. We also are mandated to maintain a central registry system to record cases and provide education, outreach, and advocacy to professionals and to the community for the prevention of abuse, neglect, and exploitation against our elderly and adults with a disability. BAPS also provides ombudsman services for elders at the skilled nursing facility of Guam Memorial Hospital Authority, St. Dominic's Senior Care Home, our 3 adult daycare centers for senior citizens, and Guma Asusena, by meeting with the elderly residents and/or their family members to address, advocate, and resolve concerns for the protection of the residents' health, safety, and welfare, while ensuring patients' rights are safeguarded. The metrics used to determine that the core mission by the Bureau of Adult Protective Services is achieved are as follows. Referrals received by BAPS are recorded and maintained using an Excel workbook to ensure appropriate referrals are responded within the timelines prescribed by Public Law 31-278. Within 24 hours, if APS has reason to believe that the adult's health and safety are in imminent danger from further abuse, and within 7 days for all their reports. Timely response to APS referrals. Admissions into Guma Serenidad is provided to victims who are in immediate or imminent danger from further abuse or neglect. Through the provision of emergency protective shelter services, BAPS safeguards the dignity and integrity of victims. APS presentations are conducted to raise awareness about abuse against the elderly and adults with disabilities, which includes and is not limited to mandated reporting, types of abuse, signs and symptoms of abuse, where, when, and how to make an APS report, and the services provided by the Bureau of Adult Protective Services, protecting the total well-being of senior citizens. Ombudsman presentations are conducted for the residents, employees, and families to raise their awareness on how to address and resolve institutional-based issues. During each presentation, attendance is taken and reviewed for validation that the presentation did occur. Further, the completion of the attendance sheet after each presentation validates the residents' the client's access to resources and information to ensure their rights are safeguarded and promote their total well-being. Outreach activities provides the opportunity for BAPS to educate, inform, and network with the community at large and on the issue of adult abuse and what they can do to stop such abuse from occurring. At each outreach event, a visitor log is maintained and received after the event to validate BAPS's participation at the event, which lends itself to promoting the total well-being of older persons on Guam. Program names within the division under the Bureau of Adult Protective Services are Intake, Investigation, Aftercare, Education and Prevention, and the administration of the Guma Serenidad Emergency Shelter with a 24-hour crisis intervention hotline. The total amount requested for the Bureau of Adult Protective Services for FY 2019, the division's budget request amount for BAPS is $805,987, and the amount requested is as follows. For personnel, we are requesting $272,730, which represents 34% of the requested amount. For contractual services, we are requesting $527,477, which is 65% of the requested amount of $805,987. And that would cover for the Guma Serenidad program at $502,745.40, so that we may be able to acquire a leased vehicle at $15,432. For miscellaneous subscription and membership fees at $800, postage services at $100, for an APS client database at $6,652, for a total of $525,729. I do want to point out that there is a difference in the subtotal amount for contractual, as I had mentioned earlier that we are requesting $527,477. The amount, which is the amount proposed, the difference of $1,748 is the amount that is proposed to be taken out of the APS database. And because this is a lump sum budget, the impact will actually be with the C2 program. Further, we are requesting for supplies and materials the amount of $2,020, for drug testing, $160, and for utilities, $3,600, again for a total of $805,987 for the Bureau of Adult Protective Services. The Bureau currently has 3 filled funded positions at the general fund amount of $206,839, and that is for a social service supervisor and 2 social worker 3. We have 1 vacant funded position at the amount of $65,891. The basis for recruitment of this vacant funded position, one of the cornerstones of our community is to ensure the safety and well-being of our elders and adults with disabilities who are at risk of being mistreated, abused, neglected, and who are unable to protect themselves from harm and have no one to protect them. Our seniors and adults with disabilities need this protection so that they can remain in their communities and live a dignified life. Therefore, the recruitment of the vacant funded Social Worker 3 position for the BPAS is critically needed to ensure the delivery of services for the protection and advocacy of our seniors and adults with disability is not compromised, and for the BAPS to reasonably carry out its mandated duties and responsibilities. The following are what makes it necessary for the recruitment of this vacant funded position. It will ensure and assist in the provision of protective services that includes intake, investigation, aftercare, emergency protective shelter services for victims of abuse who are in imminent danger, and a 24/7 crisis intervention hotline. It would allow us to represent and safeguard the interests and integrity of seniors and adults who are with disabilities who are victims of abuse. To conduct investigations at a 100% performance level of appropriate referrals received in accordance with Public Law 31-278. It will assist and/or coordinate and collaborate with government agencies, community organizations, and families for the provision of care of our seniors and adults with disabilities when addressing protective services issues. It will increase the BAPS's capacity to provide education and outreach, and ensure worker safety when conducting field work. And it would also increase personnel resource to assist in managing potential worker burnout. It would allow for scheduled planned leave for the practitioners of this bureau, and also allow practitioners dedicated writing time while managing the need to respond to referrals. I thank you for your time, and I will turn the...
And so at this time, we'd like to call on Mr. Palomo, who oversees the Bureau of Community Support, to present on the next Bureau.
Thank you, Speaker Cruz, Vice Speaker Terlahi, and Senator Nelson. The Bureau of Community Support is tasked with the responsibility to provide information, referral, and assistance services and activities to seniors, their caregivers, and family members. These services and activities can take the form of informational presentations, community outreach, and through one-to-one counseling to navigate through the social services continuum our island has available, and provides Medicare awareness and Title III and Adult Protective Service awareness presentations to contracted service providers and the general public. The Title III APS orientations are held every last Tuesday of each month, and the monthly Medicare awareness presentations are held every last Thursday of each month. BCS also conducts monthly in-service sessions with community partners such as the Case Management Services Program under the Mayor's Council of Guam and the Skilled Nursing Facility with the Guam Memorial Hospital. These presentations and in-service sessions provide our partners and Medicare beneficiaries with current Medicare information as well as any changes that have occurred with Medicare. Further, BCS administers the State Health Insurance Assistance Program, or SHIP, locally known as the Guam MAP program, the Senior Medicare Patrol Project, or SMP, the No Wrong Door Initiative. We also conduct and administer and are responsible for a volunteer program. The information and referral activities and services, under that, we work to ensure senior citizens make informed choices. We link them and refer them to services and resources on and off island. We assist them with applying for benefits and to locate resources within our community. And we assist them and their families and or caregivers to access services. Our metrics used by the Bureau include our workload outputs, in which we collect data on several different aspects. The following numbers will account for projected FY19 figures. This includes presentations, 106, conducted on aging services and programs with a projected 1,637 attendees. Outreach, 57 outreach activities at health fairs, conferences, and island-wide events, which include the manning of division booths as well as dissemination of various program brochures and booklets. This may include the Medicare and You booklet, and we also project to hit 5,820 participants and or contacts. Our office contacts, we project 1,744. This includes one-on-one counseling with Medicare beneficiaries. Media efforts, 44. This includes print, radio, static, and digital displays. And to maintain, recruit, and train yearly our volunteers, which currently we have a cadre of 14. The programs under the Bureau of Community Support, again, include IRNA, or Information Referral and Assistance, Senior Medicare Patrol Project, State Health Insurance Assistance Program, and the No Wrong Door Initiative. For FY19, under the Bureau of Community Support, we do have 2 filled positions. Those are Program Coordinator 4 and a Program Coordinator 3, totaling $133,710. The Bureau also has 2 vacant funded positions. Those are a Program Coordinator 3 and a Customer Service Representative, totaling $115,070. We think It's critical that we recruit program coordinator 3 and a customer service representative. These positions will assist in increasing awareness of what's available in the community and provide the most current information to seniors and families and assist seniors in making informed decisions. To assist seniors, families, and caretakers navigate the federal health insurance program and resolve complex billing concerns. To promote aging in place and help seniors remain self-sustaining. To assist and or be charged with maintaining the volunteer program, which translates into thousands of hours of Medicare counseling. To ensure the maintenance of grant directives, benchmarks, and reports, which include submitting annual and semi-annual reports, Compact Impact, Senior Citizen Month, Freedom of Information Act, citizen-centric reports, division budget, and the semi-annual and annual federal financial reports, as well as weekly Bureau briefs. These positions are also critical in maintaining partnerships with key stakeholders within the community to increase the division program services awareness to the island's aging populations, to work with increasing and reaching out to seniors in a language other than English, and to increase awareness to hard-to-reach populations, to make available division orientation of program services before government, nonprofit organizations, and community entities. That concludes my Bureau's presentations. Thank you for your time.
And so at this time, we'd like to call on the next presenter from the Bureau of Program Administration and Development, Mr. Nicholas.
I'm Charlene Nicholas. I'm the Program Coordinator 4. I currently oversee the Bureau of Program Administration and Development. This Bureau serves the taxpayers through funding received from the Administration of Community Living, U.S. Department of Health and Human Services, as authorized through the Older Americans Act of 1965, as amended, and local funds. The Guam State Office on Aging provides the following services either directly or through contract. For Title IIIB, there are 6 programs, supportive services, which include 3 adult daycare centers, case management, in-home services, legal assistance services, senior center operations, and transportation services. As follows, I've just got a little bit more information. For the 3 adult daycare centers, they provide approximately 119 frail seniors with supervised respite for not just the seniors, but also their family caregivers. Services are provided from 7 a.m. to 6 p.m. The 3 areas include North in dementia care to serve approximately 52 clients, Adult Daycare South to serve approximately 25 clients, Adult Daycare Central to serve approximately 42 clients. The Case Management Services Program is provided to approximately 2,000 senior citizens. The In-Home Services Program provides personal care, homemaker, and chore services to approximately 400 frail senior citizens who are homebound and are at risk of pre-institutionalization. Legal assistance services to approximately 300 senior citizens. The 12 senior citizen center sites, which is through the Senior Center Operations Program for approximately 1,200 senior citizens. Assisted transportation to approximately 372 clients, and regular transportation to approximately 377 clients. Their Bureau of Program Administration also includes Title IIIC, the Elderly Nutrition Program. C1 is our congregate meals for 15 congregate sites with a projected 194,220 meals served at designated sites. These sites are designated include the 12 senior citizen centers and 3 adult daycare centers. C2, or home delivered meals, is provided is an island-wide meal service with a projected 396,172 homebound meals delivered to our frail homebound senior citizens. Title IIID is through Preventive Health is 100% federally funded. ALID, we've identified to be provided at 4 designated centers, and it stands for Active Living Every Day. It is an evidence-based health promotion program for older adults 60 years and older that meets the Administration for Community Living's criteria for a highest level evidence-based program. Title 3E is the National Family Caregiver Support Program. It's provided to approximately 225 caregivers who are informal provider of in-home caring for an older individual 60 years and older with Alzheimer's disease or a related disorder with neurological and brain dysfunction, and approximately 25 relative caregivers 55 years and older caring for children not more than 18 years of age or individuals 19 to 59 years of age with a disability. Also with the Bureau is the Nutrition Services Incentive Program. This is 100% federally funded. And we have the Aging and Disability Resource Center, which is a software and services development, and which is also in progress. In terms of metrics used by the Bureau of Program Administration and Development to provide and administer the home and community-based programs, local metrics includes the FY19 workload output, and federal metrics includes the National Aging Program Information System, which includes information on clients registered by program and units of service by program. In terms of the 2019 Bureau of Program Administration and Development, currently the positions that are filled total 227,310 from the general fund. This includes staffing for 1 program coordinator 4 and 2 program coordinator 3s. Vacant funded positions that we are requesting for 2019 includes funds from the general fund totaling $217,556 to fund 1 program coordinator, an additional program coordinator 4, and 2 additional program coordinator 3s. What's the basis for the recruitment? For the Bureau of Program Administration and Development, as I mentioned, our Bureau provides home and community-based services. Currently, the program coordinators within this Bureau are assigned to prepare and follow through with requests for proposals, memorandum of understandings, invitation for bids process, complying with federal and local reporting requirements. At a minimum, key program deliverables and/or activities include ensuring the delivery of home and community-based programs and services without disruption, ensure compliance of federal and local reporting such as annual compact impact in November, state program reports in January, semi-annual reports for 11 programs in April and September, 2 programs of which are 100% federally funded. Additional reasons for recruitment include ensuring review and processing of monthly program reports that contain statistical, financial, and narrative components. In progress is the Guam Aging and Disability Resource Center software and services. We also want to ensure we prevent worker burnout. We are currently operating at a 50% capacity, currently with 3 staff overseeing 10 programs. I'm sure you've heard different bureaus, but for my bureau, I just want to say, you have one where 1 person is handling maybe 1 program. Right now, there's 3 of us at 10 programs. We want to ensure that time for staff to take scheduled planned leave for all workers, which I feel that we all need to using our annual leave. Additional reasons for recruitment and support includes to provide adequate and sufficient time for program staff to conduct research, writing time for planned procurements, which requires immense administrative time, provide capacity building for all program staff, which requires, again, administrative time for programs and procurement-related training. In terms of the total amount requested for each program for the Bureau of Program Administration and Development, so the amount that we are looking at total is $7,623,687,000. Of that amount, personnel accounts for 5.84% or $444,866. The remaining 94.16% is for contractual services, which accounts for $7,178,821. For contractual for Title 3B, this includes local overmatch and our federal match on the local site requirement that accounts for 80.68%. And that's for the 6 supportive services I spoke about earlier. For congregate meals, we're looking at 1.91%, and that's on the matched local requirement. For homebound, the matched local requirement is 1.28%. For the homebound local overmatch, we're looking at 8.67%. So combined for homebound, the local match and the local overmatch, we're looking at 9.94%. And for the National Family Caregiver Support Program, the local match requirement accounts for 1.63% or $124,561. So the total amount requested for each program for 2019, the division's budget request I mentioned is $444,866. Also mentioned, the Bureau of Program Administration is currently staffed with three program coordinators and is currently challenged in preparing plan procurements with only 2 program coordinators who have completed the mandatory certification and continuing education in line with Guam Public Law 32-131. In terms of total amount requested for each program, in terms of the fiscal impact that we're being faced with the Bureau, we're looking at homebound Title III C2 local overmatch of $136,370 to be not available. The reduction of the local overmatch for the home delivered meals program, nutrition services, meals to our senior citizens who are homebound will be impacted. The home delivered meal program provides home delivered meals Monday through Sunday with the exception of 10 holidays. Therefore, the meal service is to be provided for 355 service days. The impact will be to the weekend meal service provided to all participants of this program. Home delivered meals for weekend services will be provided to the 1,180 participants up through Sunday, July 21st, 2019. On Saturday, July 27th, 2019, 872 of the 1,180 participants of the weekend meal service will be served a meal, while 308 will no longer receive weekend meal service. Starting Sunday, July 28, 2019, the 1,180 participants of this program will no longer receive home-delivered meals on weekends, Saturday and Sunday from this date through Sunday, September 29, 2019. So in terms of total meals that will not be provided, that's approximately 22,728 meals for homebound seniors. So the Bureau of Program Administration and Development's Title III programs provide supportive services, are provided to senior citizens aged 60 years and older. These services include adult daycare, case management, in-home services, legal assistance services, senior center operations, and transportation services. These services comprise a formal support system for seniors to assist them in maintaining their independence, dignity, and quality of life. Additionally, these services protect their fundamental rights and distinct privileges as senior citizens residing on Guam. The programs are in line with the Older Americans Act of 1965 as reauthorized in 2016. The Elderly Nutrition Program is designed to maintain and improve the physical, psychological, and social well-being of our older persons through the provision of a balanced meal. The meal must comply with the most recent dietary guidelines for Americans published by the Secretary of Health and Human Services and Secretary of Agriculture and meet 33 1/3% of the recommended dietary allowances as established by the Food and Nutrition Board of the Institute of Medicine and National Academy of Sciences. The provision of this program is in line with the Older Americans Act of 1965 as reauthorized in 2016. In terms of where we're at in program assignments for the Bureau of Program Administration, right now I did mention all the programs, so I'm just going to go down the list. So for Title III-B Adult Daycare Services, I have my staff, Monica Antalan, overseeing that program. For Title IIIB, Case Management Services, I also have my other staff, Brianna Sablon, managing that program. In-Home Services is being managed by Brianna Sablon. Legal Assistance Services by Monica Antalan. Senior Center Operations by Brianna Sablon. Transportation Services by Monica Antalan. The Elderly Nutrition Program Congregate Meals, Monica Antalan. Elderly Nutrition Program Home Delivered Meals, Monica Antalan. Title IIID Preventive Health, Brianna Sablon. Title IIIE National Family Caregiver Support Program, Brianna Sablon. In terms of where we're at with contract status for where we're at in 2018, in terms of reporting, the Nutrition Services invitation for bid for congregate and home delivered meals, the status right now, the bid has been resubmitted to GSA, General Services Agency, on Monday, April 23rd. Currently in progress, Program Coordinator Siniclis, which is myself, is assigned to that bid. The Aging and Disability Resource Center Software and Services is currently in progress, and it's going through the contract routing and review and signature. That's assigned to Charlene Siniclis, Program Coordinator Siniclis. The in-home services, it's a new RFP, request for proposal. It's in progress. We're aiming to publish by the second week of July 2018. That's assigned to Program Coordinator Antalan. The adult daycare, a new RFP, is in progress. We're aiming to publish on the second week of July 2018. That's assigned to Program Coordinator Antalan. The case management services, new request for proposal announcement is currently in progress. We are aiming to publish by the second week of July 2018, and that's assigned to Program Coordinator Siniclis. The legal assistance services is currently in progress. Its joint assignment is Program Coordinator Antalan and Siniclis. And then the Senior Center Operations multi-step bid is with DSC for update, and that is currently assigned to Program Coordinator Siniclis. Why is this important? Why did I need to read that, the information in terms of contract status? We also need to ensure that we're in compliance with the Guam Public Law 32-131, which is the mandatory certification and continuing education that became effective on October 1st, 2016, in which all Government of Guam personnel tasked with the responsibility of purchasing or otherwise procuring goods or services need to be in compliance with. On the slides, we have 4 of the modules that are there. So there's the procurement basic training, which is the fundamentals and principles, which is a prerequisite course for the procurement basic training to include the solicitation process, methods of procurement review, and management and administration. On the contract side, as I mentioned, there are only 3 of us. Of the 3, 2 of us have completed all 4 modules. I know earlier this morning, Ms. Bertha Tyron had talked about the challenges with us as a department having to, be in line with everyone else, submitting a requisition. Well, we did have also staff who started, but when you're limited as to how many can attend, we don't make that rule. So the Brianna Sablon, who's one of them, we couldn't. We also had an AL at the time, so we'll be moving forward with the staff that do have the certification in place. In terms of projects and, I'm sorry, then that concludes my presentation.
Thank you. Thank you so much, Charlene. So going to the written presentation from the Division of Senior Citizens, we have a series of mandates on the last page, 17 of 17. And so the mandates, really just to go over them really quick, is Public Law 14-139, and this really is the establishment of the Division of Senior Citizens with our mandate to plan, coordinate, and implement programs geared toward assisting senior citizens in their needs and problems and in their attainment of maintenance of a satisfying life cycle. Our duties and responsibilities: we are the principal agency who has general and immediate purview of senior citizens' activities, programs, functions, and services under the Older Americans Act and any other federal acts with the territory of Guam. Our functions also: the division shall carry out such functions geared towards responding to the needs and problems of the elderly, including but not limited to the following: to plan, oversee, coordinate, or implement programs relative to the nutritional, home service, and transportation needs of senior citizens, and to plan, oversee, coordinate, or implement programs and activities for healthcare, including but not limited to medical, health, and social services, and special homes for the aged. Under federal grants, the division shall comply with all federal requirements and adopt such rules and regulations as needed relative to federal grants and grants and aid for the aging programs. The Division of Senior Citizens, State Office on Aging, is charged with the responsibility of administering the Title III programs mandated by the Older Americans Act of 65 as amended and reauthorized in 2016, the administration and development of Guam's 4-year State Plan on Aging, currently from 2016 to 2019, and working along with the Guam Council on Senior Citizens in the coordination or implementation of programs, activities, and services for the elderly. And as we were putting our presentation together in terms of justifying the 2019 budget, we also sat and said, gee, there's other things that we're doing that are not represented in the budget. And Charlene has also drawn on some of those in terms of the preventive health grant, which is 100% federally funded. But also, as a division, we're engaged in a grant that is from the Department of Justice, Office of Violence Against Women. It's the Training and Advocacy Services, or TASI project. And our key stakeholders, our division, the Guam Coalition Against Sexual Assault and Family Violence, the Police Department, Prosecution Division of the Attorney General's Office, Guam Judiciary, the Governor's Community Outreach, Federal Programs Office, and we have a new partner, the Public Defender Corporation. We also, as many of you know, have the annual celebration of Senior Citizens Month, and that in and of itself is a huge project, a huge undertaking for the division. We have the Senior Games, or Wega Manamka, the proclamation signing, the Conference on Aging, the Frail Elderly Mass, and last but not least, the very beloved Centenarian Celebration. In addition to projects and other interests, we also have and are represented, we represent and sit on the Guam Homeless Coalition, the Guam Developmental Disabilities Council, the Guam Council on Senior Citizens, who we work with, Serve Guam Commission, Sexual Assault Response Team, Elderly Nutrition Program Council, the Guam Coalition Against Sexual Assault and Family Violence, and the Human Trafficking Task Force. And so that concludes our presentation in terms of what we are using the funds in 2019 for. So we thank you, and Sizuas Masi, and we're here to answer your questions, Mr. Speaker, Madam Vice Speaker, and Senator Nelson.
Thank you very much for that presentation. Again, these vacant positions, yes, they are funded.
Yes, they are funded.
How long have they been vacant?
Well, they vary. The AO position was filled. She left our division, I believe, in April. She left our division in April. The PC3 in the Bureau of Program Administration and Development, one person just left in April, retirement. The other one had a promotion.
Yes, the promotion was in November. We submitted our packet in January. We know what happened in February, so.
Yeah. So when she meant February was we were impacted with everything was stalled, and there was a halt in all activities for personnel activity because of there was a significant halt in the activities for personnel recruitment because of the potential furlough that may have occurred. And so we also have a social worker 3 position, and that recruitment was submitted, was returned again because of the potential furlough. And that person retired in December of 2017. And 2017. Didn't she retire in December last year? Okay. And your PC3?
The vacancy.
Yeah. When did you? And we have another PC4 who transferred out of the Division of Senior Citizens in March of 2018. But the recruitment packet for the Social Worker 3, the PC3 under Bureau of Community Support, the Social Worker 3 under Bureau of Adult Protective Services, and the PC3 for the Bureau of Program Administration Development have been routed. And the customer service rep also, we had a person though was offered a job, and the Department of Administration had to withdraw because the person didn't pass all the screening that was required of that person. So we're having to start up some of that. The customer service rep, from the latest information I have from our personnel officer, is we're needing to recertify the funding. I know some of the other administrators and division heads talked about the process of it coming back, and then when it comes back, because so many months have elapsed, we need to recertify the funds, and so I need to work on that as well. But more than half has actually been through the system, but some are coming back. But I also want to say we've gotten the support of our acting director, so he's helping us move some of these positions forward since that whole situation with the furlough. And so there was this big stoppage on because of the potential furlough, and that's understandable. But Acting Director Cassell has given us some support to move some of these positions forward. And it's really us just, the division, because we are so understaffed, we actually have 40% of our staff present with you, just the 4 of us here, because there's only 10 of us. So every day, it's almost a constant crisis management situation. What's on the plate, what's hot, what's burning, there's a complaint, okay, we got to address that. All right, there's an accident, all right, we have this. So I'm very blessed because these guys haven't left me. I haven't left the Division of Senior Citizens. We have a PC3 managing 5 programs. I'm sure she probably could transfer somewhere and manage two programs or maybe even less. But I believe that their heart is in the right place and they're there and they're committed. And the commitment, it goes beyond 8 to 5. They're in there before 8. We're there till past, 7 last night. And I was up till what? I don't remember what time I was up. I was up really late last night trying to pull all this together for this morning's presentation, or this afternoon's presentation. But we have been moving our recruitment forward, and we'll be working with our acting director to continue on that effort.
Okay. I mean, that's good to hear, because at least yours were recent vacancies.
Yes.
In the last division with the nurses and some of those.
Oh, yeah.
Their vacancies had been years.
But it's still painful.
Yes. Yeah. But I mean, so I'm not as exorcised about yours as I was with theirs.
Please?
Yes.
Because my staff are, we ran a division and there are 10 of us, 18, and that's not even being fully staffed, and so we do everything. When Senior Citizens Month comes along, we're trying our best, but many things are running behind schedule, not where we would like it to be and where we believe it should be, but that's just the way our environment is today.
No, I mean, we'll try to assist, and we were just joking amongst ourselves that all those positions pay more than ours.
I possibly.
So, but the other thing that I was wondering about, was there any reason why you did not state who the contractors were in the 6 contracts you have? Who has the contract? Oh,
actually, there was no specific reason. What we left out when it's in the budget is the actual values of each contract, but we can definitely tell you who they are. Would you like us to do that at this time?
Yeah, go ahead.
Okay, so for nutrition, for both congregate and home delivered, we have Basil. I'm sorry? Okay. And so that's our nutrition program. Our adult daycare center is with the Mayor's Council of Guam. Case management is with the Mayor's Council of Guam. In-home services is with the Mayor's Council of Guam. Legal assistance services is with Fisher and Associates. The Senior Citizen Center operations, of which there are 12, is with the Mayor's Council of Guam. Transportation is with Cloudbrook Enterprises Incorporated, KEI. And then the National Family Caregiver Support Program is with Health Services of the Pacific.
Okay. We had spoken earlier this year about the adult services, and the mayors currently have it.
Yes, they have 4 of our programs at this time.
And as we had discussed, the previous contractor that had it, one of their complaints, though their most recent decision not to continue the bid, was one of their original concerns was the timely payment of their contract and them having to face payless paydays because they weren't getting. I was intrigued to hear that when the mayors got it, at least their president told us that they didn't accept the program until the entire contract amount was deposited into their account.
That is correct.
So how did that happen, and can that happen in the future with other contractors especially in that for that very vulnerable population, right. To make sure that they don't, if it goes to somebody outside of government, that they also have that, because you can't figure that everybody has a line of credit that's going to float them until you guys get ready. I thought that was really interesting that you were able, and I think he said it was 1.4 mil.
Yeah, I don't have the value. It's probably around that range. It may be.
So I was really intrigued that somehow we were able to find that cash and move that whole thing over. But for the last 10 years that I've been in this position, I have been having to field calls of, can you help us get
paid?
And I think you've suffered most of those phone calls from me.
Well, yes, I've had my fair share from you, Mr. Speaker.
When I call you and why?
Why, yes.
Yes.
Thank
so we've got to figure out something. And now that it's out of the bag, I mean, in fairness to the private sector vendors or the NGOs that are out there, if you can treat a government agency by giving them all the cash up front to make sure that the contract is fulfilled, you're going to be hard-pressed in the future of everybody going, you did that for them, why not for us? But that be that as it may. We were all a little concerned about your presentation about starting July 21st, July, that the meals are going to stop because of something. What was that all about?
Well, with regard to the amount that has been identified for the Division of Senior Citizens, with the reduction of option 1, we were impacted, as all 5 divisions were, and so the reduction has been isolated to the home delivered meals program. And so by isolating it to the home delivered meals program, what that then translates to into services is a reduction in service. So
that's where the cut was taken, and you want that restored.
Mr. Speaker?
Yes.
Yes, we do want it restored.
Okay.
Please.
But then my next question to you, and I've been wanting to ask you since this morning. We have always, at least since I've been in the legislature 14 years, been very generous with public health and social services. We've bent over backwards to make sure that appropriations are pretty close to what your requests are.
Thank you for that.
But I've also noticed in the past and been really perturbed, at the very least, when I see that a director of public health and social services authorizes a transfer of money out of the department. There have been transfers.
What transfer specifically?
I can't remember which one it was, but I can remember a couple of transfers, and I called.
Are you talking about special funds?
Maybe before you got there. I think you remember. You've been there long enough. Mr. Casil hasn't been, but in some of the past fiscal years, I have noticed that the department has been willing to agree with Adelut that some of their appropriation can be authorization can be transferred out. I'm hoping that none of that is happening. I haven't been as vigilant. That used to be my first thing in the morning. When I wake up, I just read all the communications to see all the transfers out, and the transfers out always catch my eye. And I have to admit, I haven't seen one for public health and social services, but I'm hoping I haven't missed one. And if I have, would you go back through your records for this fiscal year? And if there have been any authorized transfers, even by his predecessor, I need to get a copy of it so that I know. Because it seems to me you have the ability to move funds within the department. And right?
That's correct, because of lapses.
You have great transfer authority.
Yes.
I don't understand why the transfer authority isn't exercised to make sure that I don't get these starving senior scenario threats that after July 21st, 2019, I'm going to starve 22,000 seniors.
You know, Mr. Speaker, I understand our budget's a lump sum, correct?
Yes.
Okay. We will find that 136,000 somewhere so that our seniors will not starve, okay?
Thank you.
But I will accept your invitation if you want to replace that because, you know,
Okay, but I'm just saying that maybe your ASO can tell me, when we ended the last fiscal year, how much of the appropriation to public health and social services was not expended? I know it's more than the 136,000.
Are you talking about lapses, sir?
Yes.
We had over $1 million in lapses.
Yes.
We did.
So
that's because of you know, personnel not being filled and all that, GSA and so on. Okay, so we do have lapses, and you are correct. Okay, I won't deny that.
And so that's the only reason, because
yeah, but
I can imagine the listening audience, their response, if my two colleagues are looking at me like the person that kills babies and is now starving seniors. So please figure out a way.
We'll find that.
I know you had more than $1 million left over last year.
We've been helping the general fund the last how many years?
Yes.
We've been helping them.
Yes, you have.
By not spending or lapsing that much. I mean,
I agree, but
it's in the books.
But please, not at the expense of starving seniors, or having babies not immunized. Let's figure out how to transfer some money to make sure, and to assist the nurses and this group, so that all of their people are filled.
I will work closely with the nurses right now and see if I mean, you know.
Yeah, okay? Be creative, and if you have to understaff it or whatever they call that, by having someone who's an LPN, or even for some of these positions, you have it as a program coordinator 3 or 4. If a social worker, I mean, there was a huge class that just graduated. I attended the commencement, and I was very happy to see that, because you know that that's been one of my main concerns, to make sure that we have enough social workers. And so if some of those people can come over and underfill the position, you don't have to pay them as much as, or more than we're getting paid, but at least get them started so they get their half their experience. Okay? And I thank you for explaining every single one of the programs. My only concern was you didn't name but I just wanted to get that clear, of how important all of those contracts are, and the fact that your personnel cost is a fraction of your overall, because of all the major contracts that you oversee. And you more than adequately explained the reason why we should continue the funding for those now vacant positions, but they were funded. Okay, so either one of you.
I just want to thank all of you for your continued hard work, and really the speaker said it very clearly. If you are having $1 million in lapses and you're trying to help the general fund, that doesn't make any sense to me. No, you help the agency that you're responsible for, because it services the people. This money is from the people, it belongs to the people, and the purpose was put in there to fund your division. And I know, Mr. Casillo, you're the acting, so I know not a lot of this was done under your watch, but I implore you that you change this kind of practice that was done historically. And then also, tell me if I'm stepping out of my lane, but perhaps if you can't hire a program coordinator 3, maybe you can hire one or two and train them up and get 2 positions. I mean, if people don't have the experience to meet the program coordinator 3 requirement, then put them 1 or 2, and then also the funded vacant positions. If you can't feed the seniors, then move that money from the funded vacant positions to feed the seniors. I mean, I don't understand why you would put back $1 million and your whole division is suffering. The clinical services division is having issues hiring personnel because of the pay requirements, and then these guys are like balancing 10 different caseloads. I mean, that's just, and then you're giving money back. It just doesn't make any sense to me, you know? So I hope that by the end of this fiscal year, you put that money where it deserves to be, and that's within your divisions. I mean, that's your job, is to protect your division and the personnel that work for you. Thank you, Mr. Chair.
Thank you also to all of you. And I just have a couple particular questions because I share the concerns of both of my colleagues. But for example, on the vacant positions, for example, Mr. Nicholas, on the program administration and development, we've got vacant positions, program coordinator 3s at 70,000, but the existing program coordinator 3s at 65. And then there's another existing at 76. So I can understand why the existing ones might be different. Some have been there longer. Is that correct? That accounts for the difference in
the difference for the warm bodies? Yes, it would be based on step that they're on. And so
you want to hire a program coordinator 3 at a higher step than the program coordinator 3 that you have right now? Or why is the vacancy at 70?
If I may.
Yes.
As we look through and once we get a list of applicants, one of the things, of course, we do at our division is to ensure that we're selecting applicants to perform the service. And for the areas that we're looking at, I don't believe that we're going to be able to find a step 1 if we're going to look for someone with experience. If we're looking at people, potential employees that may have procurement training, they may have more government experience. So that's why we are looking at that, so we are able to process our GG1s and not wait and identify for funding. But that's just my response.
The position that you're speaking of, there is one for 65. That person, if I'm not mistaken, I don't have the person's name, but that is a person who's new to the government of Guam. And the recruitment is a little higher because of the very reason Charlene is speaking of, is that we may have a PC2 who's going to be promoted. And one of the reasons you may not hire a PC3 who is being promoted from a 2 is because you have inadequate funding. So you have to start the whole process or not select that applicant, or select an applicant within that price or salary range. So there are a lot of variables in working with the government of Guam recruitment process. So let's just say that the person is already a PC2 step 7, 8 and is higher than this. In order for me to hire that person, I actually have to go back and speak with the director and to get his support to add more funding to that position, and that has to be certified by the ASO. And if they say, well, you know, gosh, can you hire someone else within that price salary range because we just don't have the funds for that, I may pass on someone has completed all the 4 procurement classes and who can take on some of the workload for the RFP and IFB work that we do. And I'll have a PC3, warm body, and very much needed and appreciated, but not trained up yet with the 4 courses. So there's a give and take in the salary sometimes. And that's probably the discrepancy or the difference that you're seeing, Senator. Vice Speaker, sorry.
May I add also, the differences may be because
of benefits.
They have higher coverage, medical dental coverage, and say one that may be riding off the spouses and doesn't pay nothing at all.
Okay, thanks.
Right.
Yeah, I wasn't sure.
Right. So it could be benefits as well. Thanks, explanation. Appreciate that.
This thing about, I guess this is prevalent throughout the entire Department of Public Health, and that people who are running the programs all have to be certified in procurement, and we can't do the procurement centrally, like through admin, and then I guess that surprises me, and because originally all procurement was supposed to be through GSA. It was all supposed to be central. It's been the solicitation part, or the specs part, I think it is, it's been kind of put back to agencies, and and now agencies are putting that all through divisions? That surprises me. I mean, it seems to me like, I guess your divisions, you know your areas better than anyone else, but still, I mean, just to get that certified procurement officer, can't we, once you know what you want, write it up, give it to the certified procurement officers and admin and let them handle that? No? Doesn't work like that?
It's a lot more involved these days. For example, the planning record, you do determination. And so if you're working on an RFP and we disclose too much here, we'd have to have everybody sign. Then we'd have to put a planning record as part of the procurement record that we discussed it.
But all of that procurement process doesn't require expertise of senior citizens division. It requires a procurement expert, right? I mean, the expertise of the division of senior citizens is required pretty much on the specs part. And I don't know, that's what I'm thinking about. We'll talk more about it later because this is the first division or department that I've heard that that procurement is operating like this. And it might be that this is how it's done everywhere, but I'm surprised I haven't heard that. So this is the first place I've heard that all the divisions have to be certified in this new procurement for course modules. And I can see why, if that's the requirement to fill a senior citizen program coordinator, it's going to take a while. I mean, I can see why the salaries will become higher. Everything's going to become more difficult when we already have certified procurement officers in the department. And so I'll think about it, but I understand what you're saying. And I do, appreciate the expertise of the division. But maybe, let me ask you a couple more questions and maybe it will help me. So under the contract list, there's been controversy regarding this nutrition services. This is currently under emergency procurement?
That is correct.
Yes, and so the controversy is that the emergency procurement went to the contractor that there were some original issues with. Is that the case?
That is the case.
All right, and then when these contracts that are now with the mayors, like the speaker said, the main concern was the payment was delayed and it was inconsistent, and for every private contractor, that's pretty much their complaint with the government. But how was it that you were able to transfer the money to the mayors? Was that your work? You did that?
Not necessarily, Madam Vice Speaker. No, it was a commitment that was coming from our director and our deputy director that there was a situation that needed to be addressed. We presented the situation to our acting
All right,
director.
so it was a department. That's department capability that you are able to do that, to transfer money to the contractor?
We, I wasn't involved in any transfer of money, but I think the issue here is that there was there's a situation where,
No, I understand the emergency, but I want to know who was able to transfer the money.
All I can tell you from my person is that, there's the seniors here are in a situation to where if they get taken away from casco service and there's no services, of course, being armed, right? So I guess the way to make that smooth is to make everything, the way, and even the mayors, I think, pushed for that.
Of course they did. Of course, every private contractor would now push for that. Believe me.
Yes.
Because
but in this situation,
I want to know who was actually able to make it happen. That's what I want to know.
That I can tell you.
It was through a memorandum of understanding and a work request that was attached. Now that's what allowed them to transact.
So who was the MOA between?
The MOU between the Mayor's Council of Guam and the department through the Division of Senior
And the work request, is that like an invoice that says it's already completed? The work's been completed?
You can do it.
Go ahead.
The work request is typically attached to a memorandum of
Okay.
agreement or a memorandum of understanding
All right.
when we do business with another agency within our executive line agency.
Like part of your work as program coordinators, isn't it to monitor these contracts, make sure they're submitting their reports, make sure all of these things are done, and then approving the invoices? So how did the process totally change when it came to the mayors? Like they got paid in advance, it sounds to me.
Actually,
Can we go ahead, Sharon. Go ahead.
so what happens is when we have our budget, we have a set amount that we're going to have for Title III as an example. So not all funds were encumbered. A situation, of course, happened in February. Funds were needed to ensure that there was no disruption of services. We, of course, through support from our acting director, Mayor's Council of Guam, Governor's Office, we were able to, number one, make sure that we had funds available, funds that were already identified, funds that were planned. So in terms of whether or not there's mention of money in the bank, we can say that there's funds available, such as also when we route contracts, we need to ensure that funds are available. So that is what allowed us to attach, of course, the funds for the work requests. So it's not upfront in terms of drawdowns. That's done when they charge for salaries, 111, 113, 230, 240. So that's based on charges, so regular salary charges. So they don't.
So what the MOU was able to do was establish the accounts of Department of Administration. And so just like a government office, we have our accounts, our balances, and so every payday when they issue payroll, they then draw down from those accounts. So it puts the funds available on the account of the MCOG for the operations of the 3 programs that were entered into this year.
We were told by other agencies that you're considering that type of arrangement for other of the Title III services. Is that correct? Like to partner instead of with private entities, to partner with government agencies?
There is a conversation we're having, but it weighs on what their workload output would be in comparison to the private or company that is out there. And so we'd have to look at that. I mean, we wouldn't rule it out. So as an example, if a government agency came forth and said, hey, we could do this service and we could do it for less because we have this grant for the next 3 years, and so we would be able to help you run this program. And we looked at that and said, okay, we're all in line with all the grant requirements, the terms, the funding, how things are supposed to be executed and paid for. We may look at that, but there's nothing concrete yet at this time.
Well, what about this then? So the contracts that went to the mayors now, and I totally understand the emergency basis, but it looks like now you're going to send out new RFPs for several of those.
Correct.
So they will have to compete?
Well, actually, no, I don't believe the Mayor's Council will compete. The agreement we entered into was they're serving like the interim provider right now. As the acting director has noted that if we didn't have a provider, was it April 1st, then of course there would be a disruption of service to 3 major programs that we administer. So the RFP would be what we would then, is the mechanism we're using to find a new provider in hopes that they would be in place by October 1st or fiscal year 2019. So the discussion we had with Mr. Sablan was to engage a contract up through September 2018.
Okay, I wasn't aware of that either. I thought that was going to go longer. But so,
I mean, because we can't say what's going to happen with the RFP. I'm not saying that it is or that it isn't. We're hopeful that we would have people who would offers who would respond to the 3 RFPs, and if that is the case and we can successfully negotiate, then we're in business.
Okay, and then so the legal assistance services, it says in progress. When does that expire? I guess, or when does the contract end?
That's this year. Yeah, that contract expires on September 30, 2018 for FY18. And so what we would need to do is put a procurement activity in place because that contract also has a month-to-month extension up to 6 months. But in order for the 6-month extension to be activated, we would need to have procurement activity in place for that.
That's September 2018. That's just a few months from now.
Yes, and I have 2 staff who can work on that right now,
okay,
among all the others. And so I've been assisting them as well in what we can do to put all these contracts out.
Okay, and I'm sorry, so, but the mayor's, is that the same September 2018?
Yes.
Or, okay,
yes,
same, all right. And then, so what about the seniors? What does this mean with DSC for update, the senior center operations multi-step bid?
Well, the Senior Center Operations, in conversation with General Services Agency, we agreed that we will do a multi-step bid for that program. And so that program is back with us. We're having to update some of the specifications and then work back with GSA to put that bid up.
Okay, and is that one also due September 2018? Same?
Yeah.
Oh, okay.
But that one,
that
I would venture out, though, that probably, given the number of staff we have in the division working on all these procurement activities, that one in particular, we may work with Mr. Soblan to continue the Senior Center operations for a few more months into FY19, because we've got the 3 RFPs that are coming out, the publish, and that's aiming to publish in the second week of July. We have legal assistance services. We still have our ADRC, Aging Disability Resource software and services contract that's still being routed. We have the preventive health contract that has to be routed to the University of Guam. So we have a multitude of contracts that we're processing at this very time, and they're at different phases of contracting. But we definitely are shooting, hopefully, everything by the end of September, but the 3 is our primaries: ADC, adult daycare, case management, in-home, and nutrition as well.
Senator, can I make a comment? Can I make?
The public hearing room is supposed to be used for somebody else.
Oh, sorry.
Okay.
It's a valedictorian.
Just 2 more questions, if I may, Mr. Speaker. The mayor's council said there's no profit on that contract.
There
that
isn't.
It goes strictly to the employees that were already hired prior to them taking it over.
And for operations.
All right, and then the
supplies.
This money for the food for the seniors. You have lapses now that you're looking at that you can use to take care of that? Is that, they're not lapses yet, right? But,
we'll look for it.
Yeah,
like I say, it's only 136,000, and I think we can work that out. Can I just make one short comment please, on our contracts? I'm of the opinion that the programs that went to the mayors, it'd be to the best advantage of the government if they're sent out to the private sector. I mean, because they're like it was with Catholic Social Service, for example, for the last 30 years. We would save money in that, and they're more flexible in doing a lot more services than the government would be. Okay, so we've always had those services out in the private sector, even the centers. Just for some reason, we're having problems with the vendors not keeping them. Okay, and I really like to stress that. We like to keep it in the private sector, possible.
Okay, just so that everybody doesn't think I'm crazy. I know which one exorcised me so much when I saw the transfer. It was 284,646 from Vital Statistics. And
special funds, right?
And that was Vital Statistics, and then there was a 391,694 out of the Health Licensing Office. So I knew I had seen those, and so I'm just saying, I know that you guys have extra money. Please don't starve seniors and have it on my conscience. All right? Thank you.
Yes.
We stand recessed until tomorrow morning at 10 a.m.
Thank you very much.
For the Guam Police Department.